Alrighty, let's see if I can get everything in a group here.
Okay. Any of you guys want mouse pad? Okay, thank you.
What is the purpose of disclosure? What am I supposed to do?
Which is it, your FERPA disclosure?
It's the authorization. Yeah.
FERPA one. If you want us to be able to talk to anybody about your grades or not want to, so you could put your mom there and I could tell on you when you're being bad. Or you could not put her on there and I could not tell her when you're being bad.
Is that the same one that if like you end up in like the hospital and they call and say, hey, they're not coming
so
in?
FERPA is the college version of HIPAA.
Got
That's
it.
exactly what it is.
I chose not to sign that because I just didn't want anybody to be able to ask me.
Where do you get that from? Or how are we?
He's filling out other forms, but if you need to change your FERPA form, you can just go see Christy and change it at any time. Yeah, it's the same thing. The first time we sat for FERPA training, like 3 words out of their mouth, and I was like, well, why didn't you tell me it was HIPAA? I know the rules now. Can I be excused? We had an 8-hour training on that. Like, I've been doing HIPAA for a real long time, but I still have to say.
Aw.
Sierra, I just got your message. I have no idea about where. There you are.
About water.
About water.
Yeah, because I mean, if we donated jugs of water, that would be pretty heavy.
Also,
It
it
would be.
wouldn't be super expensive, and a lot of
like 88 cents.
a lot of places don't even have that great of water. Like it's not like it's bad, but
Yeah, but if they're in Larimer County, our water's pretty good.
So
yeah.
who should we ask? I mean, because
You could call them.
do some of these donations go to like homeless people?
Not so much actually, because we've got Project Homeless
That's what I
Connect.
thought it was.
This is more families,
Okay,
so they probably have running water. Yeah. Well, I'm going to go shopping tomorrow again, and I realized I got flour and sugar and brown sugar, but I didn't get any like Crisco or chocolate chips, and those are dense items. Because I really think you should be allowed to bake cookies.
Mm-hmm. I brought
With your
apple pie
family.
filling just because like people didn't
Yum.
eat pie. Are you bringing some?
Mm-hmm.
Are you bringing some?
Am I bringing some what? No, I'm not making cookies until after we're out for break. But I will have some. If you guys come to the holiday parties, I'll have some here. I'll bring them then, but I won't be doing any baking before then. But that whole weekend we'll be baking. So come to the party and have some cookies, because we always bake hundreds of dozens of cookies. So over the weekend. So much fun. And then I never want to look at another cookie the whole rest of the year by the time you're done with that. So I was thinking about what Sierra said last week about going over things more in depth. And so what I decided was, yes, we're still going to do the PowerPoint, but I will focus more on the disorders, because that's really where I draw your case studies from. So hopefully that if we focus, I'll do quick anatomy. You guys you've picked up on it pretty quickly. So I'll do anatomy quickly when we go through, and then we'll focus on the disorders and how we diagnose them and see if we can't tie those two together. Will that be helpful for you? Will that be helpful for you guys?
Yeah.
Okay.
So then, like the tests and stuff, it asks specifically about like disorders sometimes.
Okay. Yep, so I was trying to figure out how we could make that work, and I think we can. And then I was also thinking about week 4 stuff. What is week 4? Week 4 is lymphatic and urinary systems. I will try to shoehorn it in next week. But if I can't, would it be helpful if I recorded video, a quick video lecture on each of those?
Yeah.
And then you guys could just watch it?
Mm-hmm.
Yeah.
Okay, so that'll be my plan. I will try to shoehorn them in next week, but if we can't, I'll just sit down and do some Zoom videos and post them in the week 4 work so that you can watch them. Okay? Because I don't mind doing that. Where are we now? We're still week 2. We're talking about week 4 stuff, and we're still in week 2. Okay. Can you believe that next week is the last week, though? Like, snuck up.
That is crazy.
Yeah.
Can somebody do a discussion post so I can reply because then I'll forget.
Oh, okay, I'll make sure we have time to do that today, that people can do discussion posts, okay? Because we do have,
I know you're fine.
I was gonna do
she
mine
needs
last
another
night,
reply, right?
but I got distracted actually.
You could reply.
So I'll make sure that we have time tonight for you guys to at least get your initial posts. What flavors?
I got distracted by dishes
Um,
and my manager
smells so
yelling at me
good.
in Spanish.
Smells yummy.
I said I got distracted by
I've got
dishes and my manager yelling
I
at
got
me.
some, I don't remember what it's called on my hands. A friend of mine sells that perfectly posh stuff. And so I've been using a lot of that and I love it, but I always like to smell other lotions. If I could have like all of them, I would. Duplicate. Why are you being crazy here? Sorry. Okay, so the reproductive system, systems, plural. So when you do your repro labs, your virtual labs, this is the one time when you're going to have to choose female and male from the home page. Everything else is the same, right? So this is the only time you'll have to do that when you're doing your labs. Okay, let me just make sure this is recording. Yep, okay. All right, so I guess we're going to start with the male reproductive system. Would you guys like it if I handed out the sheets now and you could start labeling as we go through? Instead of waiting till
Kind of helps to
later.
look at what we're going to do.
Look at me, just changing up everything. So you can label now or not. You can just wait till we get to the diagram. Either way to me, but this way you have it. Maybe you can have a visual of what you're doing. Or a visual of what we're talking about. Okay, so the testes, I think we're pretty familiar with a lot of this stuff, right? The testes produce the sperm, and we know that the testicles are divided into two different sections, and they are filled with the seminiferous tubules, okay? And we can remember seminiferous because of semen, right? Okay. So spermatogenesis is the fancy word of saying making sperm. Genesis means beginning. Those of you who have not had MED200 yet, Genesis means beginning, and the way I remember that is because the first chapter of the Bible is Genesis, and that's the beginning. So whether you're religious or not, that's just how it works in my brain to remember that Gen or Genesis is beginning. So spermatogenesis is the formation of the sperm cells, okay? We all know what a sperm cell looks like, yes? Remember that? So that little head of the sperm cell has your 23 chromosomes, and that's what gets into the egg to mix with her 23 chromosomes, and now you've got 46. Okay. On a sperm cell, well, a sperm cell has three parts. We've got the head, the midpiece, and the tail. You could probably figure those out, right? It's the only cell in the human body, the only human cell in the human body that has a flagellum. Okay, that tail's a flagellum. We might have other cells in our body with flagella, but they don't belong there. Okay, usually bacteria will have flagellum, but the only naturally occurring human cell is a sperm that has a flagellum. Okay, inside we've got some internal accessory organs, epididymis, which is just fun to say, right? Epididymis, and epididymitis is also fun to say, I think. So the epididymis is kind of the nursery. It's after the sperm are made in the testes, they're stored in the epididymis, and they just hang out there while they grow up. Okay. Then the vas deferens is how it gets transported to the vas deferens will meet up with the seminal vesicles and then the urethra. And I think you can see that on that diagram. So this tube that's coming up is your vas deferens. So when somebody's having a vasectomy, yeah, we just cut the vas deferens right there. You take out 1/8 of an inch of it, clamp it. Some people, I worked with a doc who sutured it, which is fine, but kind of time consuming. The other doc I worked with used vascular clamps. They're just little pieces of metal that you clamp down super fast. Okay. And then you just cut out a little piece right here so that it doesn't accidentally grow back together. The problem is that if you want to reverse this, you have to cut away the scar tissue, and then you have to make up for that 1/8 of an inch, which doesn't sound like a lot, but if you're trying to reverse a vasectomy, you got to be careful. Sometimes it works, sometimes it doesn't. I think it's easier to reverse a vasectomy than it is to reverse a tubal ligation. Okay. So we've got the testes, the epididymis, which is the nursery for the sperm, and then the vas deferens, which comes up here to this little leafy thing, which is the seminal vesicle. And the seminal vesicle has fluid that that helps support the sperm.
What's the question for like when a guy gets blue balls?
Oh, nothing. Means they're uncomfortable for a while. They'll be fine.
Doesn't actually exist.
Nope. Nope, it doesn't. It's a pity ploy is what that is.
Well,
They'll
I
live.
grew up around all my cousins and stuff.
Right,
It's like,
yeah.
oh, I have this girl, she gave me blue balls. And I'm like, dude,
It means
chill.
it means they didn't get what they wanted. It's a pity ploy. So the seminal vesicles secrete fluid. So the only thing that happens, now there are some, I think education has gotten a lot better about vasectomies, but there was a long time where men thought they couldn't ejaculate if they had a vasectomy. The only thing missing after a vasectomy is the sperm. Yes?
I've always wondered this, but why are testicles outside of the body and not?
Because heat regulation. So the sperm are really sensitive to heat, and heat can kill them. So if we keep them tucked up, if we keep the testicles in the body, it's too hot, and it
So
kills
what
them.
about like temperature? Does it kill them then? Like if it's really hot, like in this room or whatever.
No, the ambient temperature, not so much.
It's just body heat.
It's just body heat. So one of the things they say is if you have a male who has not super motile sperm, they don't move very well. If they're briefs kind of guy or boxer briefs, they'll tell them to change to boxers so that there's more cooling. So they're not so tucked up into the body by the body heat. So that's why they're outside the body, is because, well, it's too, your body temperature kills the sperm. Okay. Where were we? Oh yes. So when somebody has a vasectomy, it's really the only thing missing is the sperm. You still get all of the fluids in the ejaculate, but because the sperm are always being made in the testes and always being stored in the epididymis, a vasectomy is not immediately effective. Okay, how many of you know somebody whose husband had a vasectomy and they ended up pregnant? It's because the pipes weren't clean yet.
Causes a lot of problems and
So
discontent.
many.
I do this.
So many problems. So you have to use alternative birth control for months afterwards, just to make sure that the pipes are all clean, that there's no, that the
Little
scar
guys,
tissue
like,
has.
hang out inside.
Yeah. Yeah, and you have to let the scar tissue completely, you have to let it completely heal over. Otherwise, just one or two can escape. So when you have a semen sample come in, after vasectomy, any sperm, living or dead, means it's not a clean semen sample after vasectomy. You have to have absolutely no swimmers. Even if they're not really swimming, it's not clean, got to collect another sample and bring it back. The family practice doc I worked for said about 3 to 6 months, which seems like a really long time. The urologist I worked for said 30 to 60 ejaculations. So whichever one your doc goes with. But you can't tell your patient, hey, 30 ejaculations and you're good. They have to bring the semen sample in. We have to look at it under the microscope. We have one poor guy who came back in 2 weeks after his vasectomy. Apparently, his wife was making him sleep on the couch until he got a clean sample. And he was so heartbroken in 2 weeks when we went, yeah, you're not even close. And he's like, but
Wait, why did he have to sleep on the couch? That's ridiculous.
yeah, it was ridiculous, but he was like, but you don't understand. I'm like, no, we do. And really, you managed 30 in 2 weeks? You were a busy, busy boy. It took another like 3 or 4 weeks to get a clean semen sample, but we saw him weekly for a while until he got a clean semen sample.
I can't imagine why.
I know, poor guy. He was just heartbroken, but it's been 30. Well, so maybe the family practice doc is onto something by giving a time limit instead of a number limit. I don't know. But it really is important to get the semen sample back. And pro tip, I got a couple of them for you after working in the urologist's office. Do not leave the light on the microscope if you have a semen sample on the slide, because the smell of cooked semen is disgusting. And my doc that I worked for, my urologist, he would like check semen samples between patients. So he'd run in, flip on the mic or on the microscope, put the sample on, look at it, and run off and just leave it on. And pretty soon you'd be like, oh, he did it again. So if you have a doc who's prone to that, just follow them around and turn off the microscope because you don't want that smell. It's awful. Another pro tip, if you are telling a patient to collect a semen sample, you cannot collect it in a used condom. A lot of people will bring it, they'll bring in a used condom, they'll like tie it off so the semen's still in there. Number one, gross. And number two, the spermaticide in the condom will kill anything, so we won't save swimmers. So baby food jars, usually if somebody is coming in for a vasectomy, there are babies in the house. So if you run just a glass baby food jar through the dishwasher, it's sterile enough. Or you can give them a collection container, which is what I could do. But, you know, if you're my poor guy who's coming back every week, there may not be enough collection jars in your office for him. Poor guy, I just feel so bad. Okay, so everything you didn't want to know about a vasectomy, except how to do one. Should I go off course and talk about how a vasectomy is done? Because it's so easy. Yeah, we've already talked about the after. It's so easy. What you do is, this is important because I screwed this up once and the office is closed, so I can finally live it down. But when I worked for the urologist, I worked for the urologist before I worked for the family practice, and we prepped our vasectomies differently. And every doc preps them differently. So I moved to the family practice, and my doc says, oh, you've done these before, so I want you to go ahead and prep. And he said, prep from knees to navel, and don't forget to shave. Guess what I shaved? Everything from knees to navel, because that's what he told me to do. We didn't shave in the urologist's office. He just like would take a little razor and clean off a little centimeter that he needed. So the doc comes in and he's like, what is taking you so long to prep for this? I'm like, I'm almost done, but you told me to prep from knees to navel and to shave. And he's like, you shave from knees to navel? Like, you told me to. Apparently that's not what he meant. And the patient was like, man, you are being thorough. You told me to shave you from knees to navel. That's what I heard. Prep from knees to navel. Yeah. So,
You'll grow back.
yes, and I heard about it as follow-up about how itchy it was growing back. He's like, this is awful. Why did you do this to me? I'm like, he told me to.
So what did he actually mean?
He meant to shave the anterior surface of the scrotum, which would make sense. But I'm like, man, this doc is thorough. All right, shave, 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 shave. So what should I have maybe done? Ask for clarification. I make the mistake so you don't have to. Anyway, so you shave the anterior portion of the scrotum. They'll inject a little lidocaine in, which is not comfortable. Have any of you guys ever had sutures? So lidocaine burns a little bit, about 4 or 5 seconds. It's like a bee sting, and then it goes numb. So you just inject a little bit of local lidocaine, and we don't even use a scalpel for a vasectomy. So you inject the lidocaine. Once it's numb, you take a sharpened pair of hemostats, poke through the skin, pull up the vas deferens on one side, clip, so, do whatever it is you're doing, shove it back in, go to the other side, do the other thing. That's it. Yeah, seriously.
I can do it.
She's like, oh. So the one thing that's super important about vasectomies, incredibly important, is that the patient follow the doctor's rules to the letter. This is the only time the doctor will write you a note to sit on the couch, drink beer, and watch football for 2 days. It's incredibly important to do that because this area is super vascular, right? Lots of blood flow. Well, if you do anything to increase the intra-abdominal pressure, it forces blood down into the scrotum, and there's a wound there, and it swells. So when the doctor says no lifting anything over 5 pounds, no mowing the yard, no anything, lay around, put some ice pack on your scrotum, and do nothing for 5 days or for 2 days. That's what the doctor means. We always did our vasectomies on Friday so that they would have the weekend off, and then Monday morning, at least one of my patients would call and say, my balls are going to explode. And I'd say, what did you do this weekend? And my favorite was a guy who's like, I helped my brother tile his floor. Okay. I was like, well, I bet you do think that's going to happen. It's not, but why did you tile the floor when we told you not to do anything? He said, well, I didn't lift any of the tiles. He did all of the heavy lifting. I was just on my hands and knees. Well, when you're on your hands, if we were to get down on our hands and knees right now and wait for 5 minutes, we would feel all of this pressure here, right? You have to tighten your abs to be comfortable. Well, since he spent 6 hours the day after his vasectomy, because he felt great, I felt fine. 6 hours on his hands and knees tiling. Of course, he thought his balls were going to explode. Okay? They were enormous. He thought they were necrotic because they turned that dark purple bruisey color.
They turned blue.
Yeah, well, they turned purple. Yeah, that's probably the only literal case I've seen.
Oh my goodness.
So, truly, vasectomies, you have to follow to the letter on what to do. It's not a big deal. But having worked for a urologist and the family practice, and we both did vasectomies, I kind of feel like there's no argument when guys are like, but I'm afraid. Well, quit being a baby. We'll give you some Valium. You won't even know.
it's kind of hard for you to like say, what you described to me sounds kind of painful. Well, not just kind of painful, but a
Well,
lot
it is.
painful.
But the alternative is if we get our stuff tied, it requires general anesthetic.
Okay.
So it's a literal surgery. They knock us out, they put a tube down our throat, they cut into our gut. You know.
All right.
Yeah, so it's just, yeah. So you're right. It does sound painful and it's not comfortable. It's not horrible. It's not comfortable. But when you compare it to a full-on surgery with general anesthesia, the risks are much lower because you're awake and talking to us the whole time. We'll give you some Valium, which means you won't remember it.
That's good.
Mm-hmm.
You'll be really high. You'll be really high.
Yeah, you won't care. The cool, weird thing about Valium, I don't know if it's cool or weird, is that we can give it to you and you could be interacting with us and you're going to be completely relaxed, but you're going to lose that period of your life. Like you're not going to remember anything that happened while you were on your Valium. Same with, what's the one? We gave Valium at the family practice, but at the urologist's office, we gave Versed intravenously. So they got a shot of what my doc called kickapoo joy juice. and they remember nothing. It's like they're head injured. When they come out from under, they'll ask the same questions 5, 6, 7 times. And about the 3rd time, I'm like, I already told you. Even though I know it's a side effect of their medication, I know from working with Versed that I could not work with head injured people for very long because I hate repeating myself. Like, why don't you remember? Oh, wait, you're brain damaged. That's why. Literally brain damage. So, wow, I really got off on a tangent there. But now we know about vasectomy. Super easy. Healing time goes much better if you listen, if you follow the directions. And it's hard to follow the directions because you feel pretty good. Prostate gland and the Cowper's gland. They also secrete fluids that help support the semen. And the prostate gland, we'll talk a little bit more about the prostate gland when we get to some of the disorders of the male reproductive system. We'll talk about the prostate gland some more. The external organs, the scrotum and the penis, we know the scrotum is what holds the testicles, and the scrotum does react to temperature when it's cold or fear. I have been told, not owning a pair myself, I've been told that they will retract a bit. And I had a guy, back to the vasectomy, I'm so sorry. I had a patient who was so afraid of the procedure that his scrotum completely retracted, and we had to pack him in hot packs for an hour to get the muscles and everything to relax enough to us to even get to the testicles, to move them to get to the vas deferens. Fear will do that to you, apparently. Poor guy. An hour I was making hot packs for him. And we doubled up on his Valium, and it was crazy. And so the scrotum and the penis are the external organs. At this age, we probably know about erections, orgasms, and ejaculation, right? I'm not going to turn all bright red. Should I go get Nate and have him do this lecture?
Yes, please.
And what are the male reproductive hormones off the top of your head? Testosterone. Do we all have testosterone? Mm-hmm. Do we all have estrogen and progesterone? Yeah. The only difference is the amounts we have. So all women have testosterone, all men have estrogen. The fact that we have all of these sex hormones just in different balances is the reason why we can transition. So people who are transitioning, what are we doing? We are completely changing the balance of those sex hormones. Does that make sense? So that's the reason why we can do that, is because we all already have those. We just need to change the balance of them. Okay, benign prostatic hypertrophy, BPH. He also, I think in LDT 280 in the urology class, that textbook calls it hyperplasia. It's the same thing. It just means overgrowth. The prostate is overgrown. And if you look at your diagram, and now it's upside down and I can't see it. Here's your prostate. So this is your bladder and your urethra. But here's your prostate. And it completely encircles the urethra. So if it overgrows, what can it do to the urethra? Impinge it, yeah. It just clamps down on it and then you can't pee. Is it any wonder why men who have enlarged prostates are cranky? Can you imagine not being able to pee or only being able to squeeze out a few drops of urine at a time? Yeah, I'd be cranky too. My bladder was always full and distended because of that. So BPH is benign. So is it cancerous?
No.
No. Can a prostate become enlarged and be malignant? Yeah, prostate cancer, right? So BPH is benign. We can treat it with a couple of things. We can treat it with medication to cause it to shrink. There's even a holistic treatment that my urologist recommended, and since he was about as Western medicine as you can get, for him to recommend an Eastern medicine thing was a big deal. Saw palmetto is what you can try. He would try that with patients with just beginning stages of BPH. It's not going to hurt anything, but it worked with people who just had the beginning stages of BPH. We can give some other prescription types of medication. Flomax is one of them. It just shrinks the size of the prostate. And then if it becomes too big, if that doesn't work, we can go in, excuse me, and there's a couple of procedures we can do. We can go in through the urethra to the prostate, and we can do what's called a TURP, a transurethral resection of the prostate. So they can go in and we can cut away pieces of the prostate so that it opens up. Or we can do a transurethral incision of the prostate. And that's just like cutting a piece so that it opens up. So resection, we're actually cutting pieces out. With an incision, we're just making a slice so that it opens up. We can also do some laser ablation, so go in and just destroy the tissue. So there are ways. We have a naturopathic way, pharmaceutical way, and surgical way. For really, really bad ones, we can do a prostatectomy, a radical prostatectomy. We don't usually do that with BPH. We usually save that for prostate cancer. So
it's like your prostate problems or whatever cause like balls and bumps you up. Or
no, because there are two. They're in two completely different areas of the.
Well, because like my grandpa is like really old and he's having problems. He had problems with all that.
Mm-hmm.
But he also has little bumps inside.
Yeah, that could be any number of things, but usually not related to prostate. Could just be that he's just getting older and you get some some cysts, some fibrous stuff going on. I had one poor guy come in and this was his chief complaint. So this is the reason why he came to the urologist office is that his scrotum was hanging too low. Because as he got older, your skin loses elasticity. And he's like, I'm tired of sitting on them. Well, it's not like we could do, I suppose we could do a scrotum lift, like a facelift, but we didn't. The doc's fix was, the doc was like, well, quit wearing boxers, start wearing briefs. Then you won't sit on them anymore. And this was a crusty old doctor, so he could get away with saying that because they were about the same age. So he's like, yeah, well, guess you're changing to briefs if you don't want to sit on them anymore. And you know what? The guy was happy as a clam to get that. That was his treatment. The doc said, change your underwear. And he went, oh, okay. And paid his copay and went away happily. Okay. Well, good for you. So anyway, those are the treatments for BPH. Epididymitis is an inflammation of the epididymis. And we can collect a urine sample or a semen sample. Why can we do either or? Why can we do either a urine sample or a semen sample?
For which one?
For epididymitis. Well, for really any of these, well, some of them. Because it all exits through the urethra.
That makes a lot of sense.
Yeah, everything comes, so all of the semen stuff dumps into the urethra to exit, and all of the urine dumps into the urethra to exit. So we could use either sample for epididymis or epididymitis. And we'll just look for, there will be tenderness along the testicle. So when they do their manual exam, they'll find some tenderness along it. And then we'll look for white blood cells from a sample. It's pretty simple to treat. It's antibiotics, a course of antibiotics. Erectile dysfunction, that has so many different causes. It can be psychological, it can be physical, it can be a side effect of medication, or it can be a side effect of surgery. So the biggest thing with erectile dysfunction is you have to find the root cause first before you can treat it. If it's surgical, there's not much we can do for it. So back when we started treating prostate cancer, we did what was called a radical prostatectomy. And we still do them, but not, the techniques have changed. So when you do a radical prostatectomy, so here's your prostate gland up here, right? And then this is your perineum. So for the radical prostatectomy, they would do their incision here, come up to the prostate and remove the prostate. Okay. It's horribly uncomfortable. We have a high risk of infection because of where the perineum is, right? It's right in front of the rectum. So we have high risk of infection for that. Plus, you just can't sit, right? So one of the side effects, besides all of those, one of the side effects of radical prostatectomy is that you often would hit the nerve that would control erections. So if it's surgical, there's not a ton you can do about that. There's some, you can use a pump. You can have a pump implanted into the penis, and then the pump itself is in the scrotum, so you can inflate and deflate penis if you need to, if it's a surgical thing, which is odd.
Okay, do you literally have a pump that like
Yeah.
you use? Okay, that's just so
Yeah, so it's just, you just implant it into the scrotum.
How do you
Flip it. You don't know. You can also have a, oh, I can't remember the name of it. It's been so many years. But you can have implants into your penis. But then the problem with those implants is that you're always semi-tumescent, so you're always halfway erect with those implants. So not super comfortable. So if erectile dysfunction, if it's psychological, then we have to figure out why. Okay. Some psychological stuff can be treated with medication, like Viagra, or Cialis, or whatever. Apparently Cialis only works if you're in a bathtub in a field of flowers out in the middle of nowhere. Have you ever seen that commercial? It's the dumbest commercial ever. Number one, how can you have a, I just think too logically, how can you have a bathtub full of water and bubbles in the middle of a field of wildflowers outside with no plumbing?
A lot of trips.
It's magic.
Back to the house.
It's Hollywood magic right there in our Cialis commercials. And they're always the big cast iron claw-footed tubs. Who's moving that out there for you?
They moved it themselves. It didn't never make it to the house, fell out of the back of the truck.
Right. So you guys are pretty young. You probably don't remember when Viagra came out, but it was a big, big deal. And the reason it was a big deal is because impotence treatment before then was pretty barbaric. You could use a pump that would slide over, it was like, not like a bicycle pump, but it would slide over the penis, and then you would pump it and it would draw the blood into the penis, so you could sort of have an erection that way. Or you could use an injectable medication called Caverject, and you can inject yourself with this vasodilator. What's a vasodilator? We talked about vasodilation in the cardiac unit for blood pressure. So vasodilation would make it bigger, right? Make the blood vessels bigger. So until Viagra and Cialis and all those oral meds came along, you could use a pump, or you could inject your penis with a local vasodilator. I'm sorry. I know you're getting more and more uncomfortable. You could, but because of, excuse me. No, I need to pick a time for restarting. Don't restart now. And it never gives me the option for picking the time. So we are going to pick a time, which will be 11:28 p.m. No, sorry guys, I'm afraid it will restart until I tell it, unless I tell it otherwise. But hold that thought, because I know you're having such a great time hearing about erectile dysfunction today.
Does age cause erectile dysfunction?
It can, yeah. Well, we see it more in older men because we're just wearing out. Here's the crappy thing. Well, I don't know that it's a crappy thing, but the thing is that men produce sperm until the day they die. Our eggs get old at about 30. They start getting old at about 30, 35, 40. But when women hit menopause, we're out of eggs. That's what the whole menopause thing is. So we're born with a finite number of eggs. We go through puberty, they mature, we start having our menses, and then we go through menopause, and we're out of eggs. We're done. Men can produce sperm until the day they die, which is maybe not so fair.
So when you say that we're born with all these eggs and stuff, I'm like, you know, like you hear those commercials in the radio, eggs or whatever. Is it because every time we get like a period or whatever, do we get more? Or like,
No, we have a certain number, and when we use them all up, we're done. So you can sell your eggs, but just know that you're selling. Yeah. So, oh yeah, Caverject. We have on, not we, because I don't own a penis, men. Sorry.
You keep saying you would.
I know, I'm like, wait, I don't own one of those. Never had one. Okay. Remember, I'm a stick-figure artist, so forgive my really bad rendering of this. But on each side, of the penis, so this is the actual penis itself. On each side, men have what is called a corpus.
Rowan has.
Cavernosum.
I really wish Nate would like teach this.
Can you have him come in here?
I just have to be like, I'm having a hard time explaining.
He would laugh. He would know we were up to something if I went in there and was like, I have to talk about penises today. Would you come in? So here's the urethra, right? And then on each side we have what's called a corpus cavernosum. Men. And this is what fills with blood to give an erection. Okay. So when you do the Caverject, my red blood, okay. So you inject the Caverject or the vasodilator in here, and it causes this to fill with blood and gives you an erection.
That doesn't sound very safe.
Well, it's a very small needle. It's like an insulin needle, so very small,
How
very
did you
thin.
even get the courage to just like
I know.
do that?
How bad do you want to have sex? That's what it boils down to. Okay. So this was the option for treatment. We had the injection, and then we also had just a little. It looks like a little grain of rice. that you could insert into your urethra. So you could insert that grain of rice into, well, you would lubricate it a little bit.
Okay, still.
Still, yes, because it comes in an applicator. So you have to lubricate the applicator, slide the applicator into the urethra. Put this little grain of rice in here, and it works the same way as a Caberjet. Now do you understand why it was such a big deal when we came out with oral meds for erectile dysfunction? When suddenly they could just take a Viagra and have the same effect?
Yeah, because all of that sounds stupid painful.
All of this sounds like you'll never have sex again in your life, right? Never mind, I'll pass. Yeah, so that's why the oral meds were such a big deal. And, funny side note, Viagra was not designed for erectile dysfunction. Viagra is a vasodilator. They designed it as a blood pressure medication. So if we dilate our blood vessels, what happens to our blood pressure? Resistance goes down, so our blood pressure goes down. Has this funny side effect. And so Viagra, they changed its use during the testing phase, went away from it being an antihypertensive and turned it into an erectile. Hi. Yes. Boy, did you were like, your timing's perfect. You missed all of the good stuff.
Oh, did I? And I was hoping I didn't want to disturb you.
I even had diagrams and everything.
Talking about all sorts of things that are walking past me. I was going to say anything.
Right.
So what's with the 4-hour call your doctor rule?
So, if the blood stays stagnant in the corpus cavernosum for too long, we don't want it to do what? What happens with blood? Yes, so that's why. So it should automatically, after orgasm, it should automatically drain and deflate. The problem is if it doesn't, then we're looking at some potential for clots, which means you're going to need more medication to keep those clots from forming, because you don't want a thrombus. You do not want a thrombus in your penis, nor do you want one to break away and become an embolus, right? So that's what the 4-hour big deal is. And interestingly enough, so when Viagra came out, we always had a joke about how you keep old men in nursing homes in bed, give them a Viagra, then they have a kickstand, they like roll out of bed. We used to joke about that a lot. The thing is that Viagra won't work unless there's arousal. So you can't just slip somebody a Viagra and give them an erection. There has to be interest in the first place to redirect the blood. And this happens with all of the oral erectile dysfunction drugs, they tend to give patients a headache because they're vasodilators, right? So now you've increased the pressure where you want the pressure to be increased, but also in the head. So you have to be careful with people who have had TIAs, transient ischemic attacks, people who are prone to stroke, things like that. You might not want to give them an oral erectile dysfunction drug because you don't want to increase the pressure in their brain. So a lot of patients who use Viagra and the like will have a headache. They'll get a headache. So that's easy enough to avoid, besides not taking the Viagra. Just have them take a Tylenol at the same time they take a Viagra. And it usually gets rid of the headache. So I had this little old man, he was 78 or so, his wife was about the same age. And apparently they'd been having problems for a while. And he came in and he got on this Viagra. It was magic. And the doc said every time we gave it to somebody for the first time, he'd say, I need you to call me back and let me know how it worked. You know, we need to know if this is going to work for you, if we need to increase the dosage, decrease the dosage, whatever. And this little old man, God, I love this man, deaf. You know, he could only talk to you by screaming at you because he couldn't hear anything. So he calls and I answer the phone and he is screaming into the phone. He's just so excited about how great his performance was and how those wonderful blue pills have just saved his marriage. They've been married 60 years, but okay, yeah, it's saving your marriage. And, you know, he's just but he can't hear me on the phone, so I have to be screaming back at him. So I'm standing at the receptionist desk because we have a small office. So everybody can hear his conversation to me because he's screaming through the phone and my conversation with him. So he's going on and on and on about how great his performance was and how my doctor's the best doctor on the planet, blah, blah, blah. And at the very end, he says, "Can I get some for my wife?" No, you can't. It hasn't been approved for women. Are you sure? Yeah, I'm sure. And he just had this little, sweet little, like, Santa Claus wife. I could just see him chasing her around the house and her saying, "No." But, yeah.
Is there a, I'm sure we'll go over it when we go into the female reproductive system, but is there like a female equivalent to ED?
No, not so much. Okay, is that everything you didn't want to know about erectile dysfunction?
And more.
And then some. You can't say you didn't get your money's worth today. Okay, prostate cancer is cancer of the prostate, right? Makes perfect sense. But we have some screening tools for this. The PSA is the prostate-specific antigen, and that helps us screen for prostate cancer. Now, a while ago, there was a big pushback on on the PSA. And it's one of the few tests we have for cancer detection. But there were some people who got upset, some men who got upset because they had their PSA done and it came back high. So it's prostate-specific antigen. So we're looking to see if there's any increased hormones being secreted by the prostate. And so they came back high. And then they have to go through, if you have high PSA, then there's a couple of things we have to do. It's just a screening tool for prostate cancer. It doesn't tell you yes or no. It's just screening. If it's high, we're gonna look a little bit more in depth at it. So if your PSA comes back high, you okay? Then what we're gonna do is we're going to do a TRUS, a transrectal ultrasound, which is as uncomfortable as it sounds. Well, I don't know. Yeah, it's as uncomfortable. They use the same wand as they do for a transvaginal ultrasound. So it's uncomfortable. And so we do a transrectal ultrasound because that's the only way to get to the prostate, right? It's through the rectum or through the urethra, and that ultrasound head won't go there. So we do a transrectal ultrasound, we look at the prostate, and what we're looking for when we do that are areas called hypoechoic areas. It's a fancy way of saying black spots on the prostate. And if we find a black spot on the prostate, they will do a biopsy, a prostate biopsy. It's usually pretty simple to do because it's not happening to my prostate that I don't have. But they go in and they use the ultrasound wand. If they find these hypoechoic areas, then they go in with just a little, it's just a little attachment that slides through the ultrasound or slides alongside the ultrasound head, and they take a piece off. They just biopsy it right then and there. Now, the doc that I worked for had been working in urology for 27 years. He was pretty good. He could tell by the feel of the biopsy when he went to snip it off. He could tell. He'd look at me and go, luckily, the patients weren't looking at me, but he would tell me, yep, that one's cancer, yep, that one's cancer, nope, this is good, this, yeah. Because after 27 years of doing this, you develop a feel for what a normal bite of the prostate feels like through the machine, or one that has to work a little bit harder. So then we would take a biopsy, we take several biopsies, we send it to the lab, and then that tells us whether or not they've got prostate cancer. But a few years ago, there was a whole group of men who tried to get us to change our stance on PSAs because they had such a false high rate. So we had false positives, and then men had to go do this TRUS, the transrectal ultrasound, and they would be like, but You had me all scared because I thought I had prostate cancer, and then I had to do an ultrasound, and I don't. And so they tried to get us to get rid of the PSA. The PSA is still one of the best ways to screen for prostate cancer because there are no outward signs. It's not like breast cancer where you can do test, self-test and feel lumps. You might be able to feel lumps in the prostate. You actually can feel lumps in the prostate through a digital rectal exam. But how many men are going to do their own digital rectal exams monthly? I mean, there's a small subset who will, but for the most part, that's the no-no zone. And so most men aren't going to do it. But there was a whole big push of men who were like, no, we have too many false positives, so we shouldn't do it at all. But what about the people who weren't false positive and we saved their lives with this blood test? The blood test came back high, they did the transrectal ultrasound, oh my God, I've got prostate cancer, and then we could treat it and move on. It was the most ridiculous thing I had ever heard. I'm sorry you were scared that you had prostate cancer, but instead of being scared that you had prostate cancer, why don't you be relieved that
there was
you
a
don't?
test to let you know that you
Right, that you don't.
cancer.
Right, so yeah, I know that trust is uncomfortable. And I know I have no sympathy because I've been getting pap smears since I was 15. So, whatever, you were uncomfortable once.
Get over it.
And trust me, a truss is much less invasive than the colonoscopy you have no issue with. Okay, so that is how we find prostate cancer. The PSA, if it comes back high, we'll do a digital rectal exam, which my doc called the single finger salute. And you can feel, so the prostate feels like this part of your thumb, okay? Kind of firm, but not too firm. Certainly not too fleshy. And you can feel some nodules in it if there are any. And so you'll get your DRE, which is, I don't think a big deal. And then the truss with the biopsies, and that's how we diagnose prostate cancer. If a patient comes back with prostate cancer, then we're going to do a body scan because prostate cancer loves to metastasize to the bones. It shifts to the bones like that. Okay. So we'll do a full body scan to see if we have cancer in the bones from our prostate, and that may or may not change our treatment. So treatment for prostate cancer can include hormone therapy. It can include like a laser ablation of the prostate, or it can include a radical prostatectomy or some sort of combination of the three. So let's go on break, and when we come back, we'll talk about prostate cancer more. Okay. Remind me when we come back to start the recording again, please. Thanks. Okay, so where were we? Prostate cancer. We talked about how to diagnose it, right? We do a body scan. We look to see if it has gone to the bones. And then treatment, of course, depends on how far along it is. We can treat with hormones. Prostate cancer loves testosterone. Like it feeds on testosterone. So we essentially have to put these men into menopause. We give them high doses of not testosterone. Okay. So they will end up with the same types of symptoms as a woman going through menopause. They get hot flashes. They get really weepy. Some of them have gynecomastia. Do you know what that is? You ever heard it? Gynecomastia is growth of the breast tissue. Okay. They get weepy, they get hot flashes, weird appetites. Usually we kill their sex drive with all of these hormones because their body is incomplete. We completely whack them out. So we will treat them with hormones. We can go in and cut it out. We can treat them with radioactive seeds. So we can do a gold seed implant where they just go in through the urethra and they put these radioactive pellets into the prostate that will kill off the prostate tissue. And then the last thing we would do is a radical prostatectomy. That used to be first line, radical prostatectomy. That was the only treatment we had. But as technology advanced, we can do these other things that are much less invasive, have a lower risk of infection, and can preserve some quality of life. The treatment for prostate cancer can be very expensive. The Zoladex, which is a little pellet that is inserted subcutaneously in the abdomen. And the Zoladex, I worked for the urologist in 2001. The Zoladex was about $1,800 per pellet, and we did that once a month. So what we would do is, we have the 4 quadrants of the abdomen, right? Remember that? So we've got our umbilicus, and then we've got 4 quadrants. So Zoladex is an implant. And I'm sure there are more on the market now with different names, but this is the brand we use. So what we would do is we would take some ethyl chloride and we would spray the air, because we had to use a 14 gauge. It came preloaded in a 14 gauge needle. So we had to numb the area with ethyl chloride, which makes it cold. And you would spray that on there until the skin turned white. And they call it blanching out, but it turns like this color white, like frostbite color white. And so we'd spray with ethyl chloride, and then since it's subcutaneous, we would come in at an angle underneath the skin. And once you freeze skin, it is surprisingly hard to get a needle through. Okay. So you would come in subcutaneously, and then when you push the plunger in, it had so here's your needle, and then your syringe back here. So you have this pellet, and the plunger of the syringe would push this pellet out under the skin. So you had to push the plunger down here. You'd have to push the plunger down all the way to make sure that this implant's cleared here.
Did you feel it after?
Yeah. So you go in, you do that, it left a huge hole in their skin, of course, because it's a 14 gauge needle, right? And the important thing with this is that you had to rotate quadrants because of all the scar tissue. And I had one gentleman who was wheelchair bound and had been getting his Zoladex for years. His whole abdomen was just a mass of scar tissue. So giving him his Zoladex was always difficult because you always ran into scar tissue that you had to punch through. But if you didn't push the plunger all the way and the pellet fell out, you were out $1,800 because that's what each one of these stupid things costs. Every month, that's what this costs. Lupron is not an implant. Lupron, it's actually, the name is Lupron Depot, which is spelled a lot like Depot, D-E-P-O-T. But Lupron is an injection that we would give either once a month or once every 3 months instead of being an implant into the abdomen. So we would do a deep IM injection of Lupron Depot, and it would be like the hormone. So that's what we would give to manage. A lot of this was just to manage the prostate cancer after surgery. We had one patient come in, and he's probably long dead by now, but I don't know. He was like time he got to us, he'd actually been a patient there for years before I started working for the doc. And when he came in, his PSA was off the charts, and his family doc said, "You've got to go to the urologist right now." And my doc looked at him, looked at his test results, and said, "Ooh, well, we're going to go ahead, we're going to do a biopsy, but you definitely have prostate cancer even without the biopsy, so I'm going to start you on treatment now." He said, "But get your affairs in order. You've got 2 weeks, tops. Your cancer's gotten so bad." So they did the biopsy. The doc started him on Lupron. They came back and the doc said, "If you're alive in 2 weeks, we'll put together a treatment plan." And by the time I started working for the doc,
You can say that. You can say that.
well, you maybe shouldn't, but I worked for an old crusty doctor who laid it on the line. If you were at all sensitive about hearing the truth, you would not be a good patient for him. But his patients loved him because he was a straight shooter. He never sugarcoated anything. He told this patient, "If you're alive in 2 weeks, we'll do surgery." And so the patient got his affairs in order, did everything that he was supposed to do, said his goodbyes, and in 2 weeks came back and they did surgery. And he had been alive 3 years by the time I started working for him, and was still coming in for his treatments. He had a radical prostatectomy, but his cancer had metastasized to the bones. When they did a bone scan, all of his bones were bright red. So he had cancer all through his bones. So he considered my doctor a miracle worker. And the only reason I know this story is because the patient sat me down on his visit in, and he was like, "I have to tell you about the doctor." And I've been there a week. I go, "What?" Oh my God, what I get myself into. And so he told me this story about how the doc had saved his life. And he was still alive when I left the practice. So it was a combination of good medical treatment and just a flat out will to live. So I put my affairs in order, but I knew I had way more things to do, and I couldn't do it in 2 weeks. I had, grandchildren I wanted to see. And yeah. So 5 years after being told that he had 2 weeks to live, he was still alive and doing everything. It was awesome. I loved that man. So I think a lot of it is attitude when you do that. Okay, so questions about prostate cancer? No? Okay, prostatitis is not prostate cancer and it's not BPH. It's just an inflamed prostate. It can happen. It can be a bacterial infection. We usually treat it with antibiotics. And the way we diagnose prostatitis is we do a prostate massage. It's basically the digital rectal exam, massage the prostate a little bit, then have them give a urine sample. Why does a urine sample work? Exactly, because it travels through the urethra. And then we can look at the urine sample to see if there are any white blood cells. And I did have a kid come in who passed out after this digital rectal exam. He came in because the complaint was that he just felt heavy, like his bladder, his lower abdomen just felt heavy. If you've ever had a bladder infection, you kind of know that heavy feeling. And the kid thought he had a bladder infection, but it wasn't. That's not what it was. Then the doc said, "Well, let's see if it's a prostate infection." So he did his DRE, left, and I hear this. Oh, and this kid was like 19, and he was just so traumatized by the DRE that he passed clean out. I don't know which was more appalling for him, the fact that he had the single finger salute, or the fact that when he passed out, his pants were still around his ankles. So when he came to, there I was. He was like, "Oh my God, sorry." And it's been a really bad day for you. That's all I can. I mean, it's been a really bad day, and I'm sorry. But the good news is you just have prostatitis. Take this antibiotic, and you'll feel better in a couple of days. Poor guy. But all I could think of, I heard that thump, because the doctor already left and I heard that thump. And there's only one sound of a body falling. If you've ever heard a body falling, it's, you know the sound. And I thought, oh my God, he hit his head on something. I thought we were going to have to do stitches or, yeah. But he managed to not bust his head open.
When you mentioned that sound, it's funny because like I'll hear my daughter fall in the kitchen and I'll be like, oh, she fell on her butt. Or then I'll hear another sound, I'll be like, oops, I think she hit her head.
Right, you know the sound. It's true. You only have to hear it a couple of times. And you're like, oh wait, I know what that is. Okay. Testicular cancer. Now this is the one exam all males should do every month, just like we're supposed to do breast exams. I'm not even going to ask who does their breast exams every month because, well, you would lie to me anyway.
I do because my aunt had breast
Because
cancer,
so you have a reason to do it.
so I go get tested in 2 years.
Good. But testicular cancer hits young people. Like, you can't wait till you're 30 to start checking your testicles. That could be way too late. My poor boys, because they were coming into puberty as I was working at the urologist's office. So they got a nice shower hang tag on how to do a testicular self-exam, and they got all of them.
Hey, that's good information.
Yeah. So testicular cancer needs to be identified right away because it can kill you right away. What you're feeling for on the testicles are any lumpy bumpies that are not supposed to be there. It is imperative that if you identify a lump on a testicle that you go, or that the person goes to the doctor right away. It might be nothing, or it might be something. And this hits very young. I made my kids start doing their TSEs at about 15. But I think 15 to 25 is where we really start seeing it, 19-ish. So as you go through puberty and hormones are ramping up is when testicular cancer, you're really at risk for testicular cancer. I think they've widened those ages now. It used to be like 19 to 25, but I think now they've widened it to almost 30, like 15 to 30. The treatment is an orchiectomy. I'll write that down. An orchiectomy is a surgical removal of the testicle. So one of the root words for testicle is orchi. So we do an orchiectomy. And we can put in a prosthetic testicle so that you still have the outward appearance of two testicles. I almost said multiple testicles, but we really don't want to.
But you can live with one, right?
Oh, yeah. You can still even have kids with one.
Not you, but.
Yes, I know what you mean. I've been saying we all morning.
Yeah, well,
Yeah.
this guy at like my high school, he only had one shirt because he's so comfortable about it. But and people would ask him like, isn't it like, I don't know, is it the same strength? And I guess he was so educated on it. He said that like if his body and his health is good, like it works just
fine. Mm-hmm. Yep. If somebody has to have a bilateral orchiectomy, then they would have to be on testosterone the rest of their life. But the good thing about testicular cancer is it usually only attacks one testicle, not both.
So why would you want to put a prosthetic?
Just for appearances. Yeah. It's really just this little thing.
It's a little
That's-
possible, like.
Yeah, basically. So that it appears and feels like a testicle. Yeah. Orchiectomy is, and it has to be done quickly. As soon as testicular cancer is suspected, you need to get a testicular ultrasound. And we didn't biopsy ours. We just immediately went to orchiectomy. I assume that you could biopsy, but because you have to move so quickly. So what we would do, and we really only had a couple. One kid sticks out in my mind. I'll talk about him in a minute. But what they would do is go in, do the orchiectomy, and send the whole testicle to pathology for testing. Instead of trying to biopsy a piece here and there, the whole thing went for testing. So we had this kid, and you'll probably get all these same stories in urology class, I'm sorry. We had this kid come in, it was a Thursday evening, and his mom called, and he was 18 or 19 years old, he was a kid. And she said, my son needs to be seen because he's got a lump on his testicle. Absolutely, we will get him in right now. So he came in Thursday evening, and the doc did his manual exam and felt it and said, you're going to surgery tomorrow. You're having an orchiectomy Friday morning. I scheduled it, the whole 9 yards. Which is, when you're 18, 19 years old, to have surgery that fast, the kid was like, Mom, it's not a big deal. It's just a lump, it'll go away. And his mom was like, no, you're going right now. He would have never told his mom. His mom found out because his girlfriend, and now remember these two were in high school, his girlfriend noticed the lump while they were having sex and said, you need to tell your mom. Now what kid is going to say, hey Mom, well, my girlfriend and I were having sex. She found a lump on my testicle. I mean, nobody in high school is going to say that, right? And she said, you have to tell your mom, you have to tell your mom, you have to tell your mom. There's something not right. And she worried and worried and worried. So this high school girl called his mother and told, and saved his life. But I don't know that I would have had, I don't think I could have made that phone call if I had been her age. You know?
You don't want them to die. I mean, like, you really care about them. It's kind of like you have to get over that shame part where you're like, oh my gosh, we're doing something we're not supposed to be
Now I
doing.
have to admit to his mom that we're having sex.
But Mom could have known already that they were sexually
She
active.
totally did.
Okay, they're like 18, 19.
I mean,
Yeah,
it could've been
I just
something.
assumed my children were. I didn't ask. I just made an
And that's the
assumption.
thing, like, you're the mother to receive that phone call, like us that have children, but if we're the ones, and I'm gonna be like, really?
Right. That was,
I mean, I might know, she may like later on.
but you don't want to
like,
know.
Yeah, you know, like we know, but we don't
But
want
we
you to know.
pretend we
What I
don't.
don't know doesn't hurt me until I do know. So
Exactly. But you
I don't
know,
want to be that mom to be like,
it worked
oh,
out.
your daughter this and this, me and your daughter, and I'm gonna be like, okay, give me a minute.
The thing is that you have a daughter. So your automatic thing is, somebody's touching my baby.
Right.
It's like with a boy, like, and I noticed this because I have both, that like, with my son, I'm gonna be like, man, just don't get her pregnant. Like, just don't.
Right.
But with my daughter, I'm like, don't touch my kid or I'm gonna stab you.
Right.
Like,
So,
Yeah. So, I mean, kudos to this mom who handled it so well. And she was the kind of mom that was like, well, we better do something about it. And called and made the appointment within minutes of getting off the phone with his girlfriend, called and made the appointment. And in less than 24 hours, he was having an orchiectomy. So it was pretty, I mean, I have so much respect for the girlfriend and for the mom who was like, all right, thanks for letting me know. We're going to take care of it. You know, I don't know that I could have been in either position as gracefully as they were. That makes sense. And that's the night I came home with the testicular self-exam shower cards for my children. I was like, yep, nope, we're not doing this. We're not. And one of the things that they don't have on here, which happens junior high, high school age, is testicular torsion.
so what exactly happens with a testicular torsion? I know what happens with an ovarian torsion.
Same thing, it gets twisted up, blood flow gets compromised.
Okay.
Okay, and the reason we see this in high school and more in junior high than in high school is, what do junior high boys love to do? At least they did when my kids were little and when I was in high school. They love to run around and smack each other in the genitals, right? I don't understand. It's not like I ran up to my best friend in junior high and smacked her in the boob. I don't get why boys think it's hilarious. They walk up and they smack each other on the way by. Rowan, what is that about?
I have never personally had that experience.
Okay, good.
I'm gonna probably have to, now that I know that this is a thing, because I didn't know this was a thing, I'm gonna have to like tell my son that if somebody comes up and like does that, you punch him in the face, don't hit him back there, just punch him in the face, walk away.
I'm just gonna say right now, like, getting hit in the balls is like the most painful thing ever.
Right.
And
So which is why I don't understand why boys do that to each other.
Boys are mean.
Because it hurts.
It does, and then
You
it's
wanna
funny.
see them like,
But-
"Oh."
Here's the problem with testicular torsion. If you get hit just right, it can flip that testicle either up or twist it around or twist around the other testicle. Because it's just dangling by the vas deferens. It's just hanging on by the vas deferens, and so you can get that twisted, which pinches the blood flow, and then they can lose their testicle.
Do they do ultrasound?
Yes.
Okay, so
So there's normal getting hit in the balls pain. So I've heard, because I don't know them. And then there is, oh my God, something is very, very wrong, like hours after. Okay. So there's the residual, you get hit and you're kind of sore and it's not funny, but your friends think it's hilarious.
And then you turn around and do it to your friends because.
Right, because you're boys.
Hilarious.
do you remember when I told
I
you
don't understand that.
that my man was gonna go to the urgent care or whatever?
Yeah.
So they did all these exams on him and they did an ultrasound to see if he had that.
Testicular torsion.
Yeah. It turned out he just had like a contusion. It was just sore from the impact of it.
Right.
Like they did ultrasounds and they wanted to like stick tubes in the urethra just to flush it. But I was like, but
Right.
it ended up like everything being okay. But yeah, that's why I was gonna ask if it was ultrasound because I think
Yep, that's exactly what we would look for.
because they told him that if it would have turned, it could block off.
Right. And then it becomes a medical emergency because what happens when blood flow is blocked off to any part of the body? Tissues die. Right. So I don't know why they don't have testicular torsion in here, but this is one that we see with any kind of scrotal impact. But it seems like 12, 13-year-old boys find that quite humorous.
It's not funny.
I don't know. Or girls, yeah, girls do it too. I just don't.
My brother's best friend thought that it was the funniest thing in the world to kick him in the balls. She thought it was the funniest thing in the world. And it was so bad, one of the times that she did it, it took him 15 minutes to get to the nurse's office.
Right.
Because she did it at
And then
school.
but look at the damage you do.
Yeah.
So
So what's wrong with people?
Educate the children.
what?
Let's educate the children.
Yeah, not only should you not be touching each other there, but you could permanently hurt somebody.
Yeah. It's,
I mean, it hurts so much that I've like
Vomited, yeah.
it's my brother passed out. Like he's like, everything just went black. He's like, I don't remember. He's like, and I was in so much pain. Somebody had to help him. She kicked him so hard, watched him drop to the ground, and then left him
Right.
in pain. I was
So-
like, I hate you.
So then there's that initial pain. But if that initial pain
Yeah.
lingers, then you have to go to the doc and get an ultrasound to make sure that that hasn't been twisted because you don't want that tissue to die.
I think you've mentioned that sometimes when like they get hit like that, it feels like they don't have hair.
Yeah.
Why is that again?
It's just the pain is so intense. Yeah, everything in your body tenses up. So, yeah, it's awful. Okay. Now we can go to the ladies. You're off the hot seat now.
Thank
you. Okay. You think you're off the hot seat. I'm sure we can come up with some others. Here. All right. So, ovaries produce eggs, except they don't really produce eggs because why? We're born with eggs. What they do is they mature the eggs. So we're born with a finite number of eggs. And then when we hit puberty, that's when those eggs start maturing. And when we get our period, that's when the eggs have died off and we're sloughing the endometrial lining.
How many eggs?
I don't know. You could look it up. But,
It's probably relative to the person.
1 a month from the time you're 12 until you're 50.
Some people go through menopause earlier.
Yep. And some people start their periods late.
Or way early.
Or way
Way
earlier.
early, yeah.
I know someone that started at 9, and I was like, how does that even?
How miserable.
She cried. She was so scared.
Well, yeah, because most parents don't think of having them off that young.
She was my little sister. She's my little sister, but it was like she was so distraught. She didn't even want to like tell anybody, so she found me and started talking to me, and I was like, "It's okay, you're fine."
My little sister started asking us the other day why we always have to go buy pads and tampons, and we're like, well, there's just a time you just start getting these periods, and you kind of need to do things to maintain yourself to be clean. So I feel like when she does get her first period, she'll kind of just come to either one of us, or
Right, and
she'll know where the
it's not so taboo. I think we have done great in the last couple generations of not
Shaming.
it's just a thing. It's just what happens. And if you have a problem with it, well, that's not my problem.
My aunt's mom told her that she must have lost her virginity because she had her first period. She's like, "You're just a slut. You had your first period." I'm like, doesn't even make sense.
I feel like you used to come around like that because I feel like
Yeah.
once you get your period, like you feel like you're gonna go have sex now, or like you.
Yeah.
I don't know.
Yeah, while I'm bleeding out of my
I thought it was like this like,
first thing on
terrible
my
thing.
mind at 9 or 10 years old.
Right.
I thought it was terrible that somebody would do that. I was like, I started my period when I lived with my dad. He's like, "You're not going to school. You're gonna stay home. I'm leaving work. I'll be there soon." And it was like, oh, everything's fine. It was really embarrassing that it was my dad,
Right.
but it was, I'm gonna be there. Just give me a couple minutes.
Right.
So
Yeah, so I think generationally, we've done a great job of moving away from that whole, at least in the US. Now, there's still countries where the woman cannot be seen during
Yeah.
her period.
Well, that's why like have you seen like all these I don't want to like be racist or anything, but like the black people how they put this they dress up different. They dress different and they put those stuff.
the small.
Somalians.
Oh, right.
So like they don't have to wear that until they get their first period. They have to start like covering themselves.
So here's a big sign. Guess what happened? I don't know.
Yeah, honestly, because that's all you would see like us growing up in middle school and stuff.
Mhm.
And like I used to live somewhere else, and my neighbors were Somalians, and then they tell us like once you get your period, like I have to cover myself, like this is all sacred.
Right. I mean, good for them.
That's just like their religion.
Their religious beliefs.
So I guess it's just kind of.
I just think that generationally, we've done a really good job of taking the shame out of it. So our internal accessory organs of the reproductive system, fallopian tubes. Now, notice on here that the fallopian tubes do not touch the ovaries. So they're more like a catcher's mitt. So when the egg is released from the ovary, it just kind of floats out here until the fimbriae, which is what those little fingers are called. So the fimbriae catch the egg, and then the egg moves down. And fertilization actually occurs in the fallopian tube, not in the uterus.
Which is how tubal pregnancies happen.
Exactly. What's the other phrase for tubal pregnancies?
I don't remember. Sure, that has something to do with fallopian.
It doesn't though.
Does it?
Ectopic.
Oh, that's right.
Ectopic pregnancies. It just means out of the uterus pregnancies. So ectopic pregnancies can actually implant anywhere in the abdomen. Can you bring a baby to term with an ectopic pregnancy? It's out of the uterus.
With the right care.
No, it would
Not
kill
at all.
you, wouldn't
Yep,
it?
it kills. Yeah, it'll kill the mom.
Seriously, because I know a lady like she went to like almost 5 months.
Mm-hmm. She must not have had any symptoms of it. So ectopic pregnancies typically occur in the fallopian tube, and then as the fetus grows, you get pain because it ruptures the fallopian tube. But if it implants anywhere outside of that, you may not have any symptoms to tell you that until they do ultrasounds, you may not ever have any symptoms of it not being in the uterus. But it is a life-threatening emergency to the mother because of all the blood loss if it ruptures. I know I've mentioned Mrs. Angemi before. She actually had a picture of an ectopic pregnancy that made it 14 weeks.
Oh, she just posted it.
That was like 2 weeks ago. That made it 14 weeks. And it was implanted on the intestine or the abdominal wall instead of in the uterus where it belongs. So the fimbriae catch the ovum or the egg, and then it sweeps it down through peristaltic movement. Have you guys heard? You've heard peristaltic movement before, right? When you do your GI, those of you who've had the first half of anatomy. So it's like how a snake swallows. It's just a wave-like movement. So it moves it down. Oogenesis or oogenesis. I hate to say oogenesis because I feel like I'm a monkey. So it's oogenesis for me. Genesis means what? Beginning. So beginning of ovum or beginning of the egg. We have our fallopian tube, we have our uterus, and we have our vagina. The external organs are, of course, what we can see. The labia majora and minora, the clitoris, and the perineum. So just like the perineum here on a male, which is between the rectum and the back of the scrotum, we have a perineum as well. If you've had babies and you had an episiotomy, when they bring out the hedge clippers, cut that. What they're cutting is your perineum. Do not confuse perineum with peritoneum. Two different things. One is in the abdomen and one is not.
When my daughter was born, she had like a little, like, I don't want to say like a hole, but it was like a dimple looking thing on the perineum.
On the perineum, and then it sealed up.
Yeah.
Yeah, that's pretty common. Yeah. So Bartholin's glands are the glands that secrete. They constantly are secreting, but during arousal they secrete a lot more lubrication. You can actually get a cyst. I had a patient with a Bartholin's gland cyst, and that poor woman, it was the size, it looked like her uterus had prolapsed. And so when a uterus prolapses, it really just falls out of the vagina. And that's what it looked like. She was waddling like this because she couldn't touch. But she had a cyst in her Bartholin's gland, a blockage. So it just kept, since the Bartholin's gland continually secretes, it just kept filling up and filling up and filling up. So she had this cyst that was like softball size. And we had to go in and drain it. And so we drained it once, and usually that does it. But this poor thing came back the next day, and it had filled up again, and sealed over and filled up again. So we had to put a drain in it. And we literally cut into the gland, put a rubber drain in it and sutured it up until it healed. That's the only time I have almost had a dirty needle stick, because since I was assisting, I had to hold her labia open for the doc. And that's, well, when you have gloves on and you add liquid to gloves, it gets really slippery, right? So I had to hold her labia open while I was trying to sew it in. And he dropped the suture. He got the bite with the suture and then dropped the suture needle and went to pick it up and just barely caught my glove. And talk about heart stopping. I am so picky about needle safety. So picky about needle safety. But when you're not the one handling the needle, it's out of your control, and you feel that just tug on the glove. I thought, oh God, now I've been stuck. But you can't do anything. Can't do a darn thing because we still have to finish up. But it turns out it only got the glove. But if you ever have a needle stick, your heart will stop, and you will be like, I made sure from that point forward, whenever I assisted that doctor, that I kept my hands as far away from his sharp objects as I could. Part of it was we were in such a, I don't think he even realized he caught it, but I just, from that point on, kept my hands as far away from any of his sharps as I possibly could. Because, whew, it's crazy. Okay. Do we need to talk about erection? Do we know what that is anymore? What happens? I mean, we don't have a penis.
The clitoris.
Yeah, the clitoris gets erect. And the lubrication comes from Bartholin's gland. And we don't have to talk about orgasm, do we? Nope. Okay. Menarche is your very first period. We only get one menarche. We get periods every month, or so, depending. But we only get one menarche, and that's your very first one. Okay. And then menopause, I've already mentioned, happens when we run out of eggs. Okay. That's really it. Are you kidding me? How many pages of male stuff did we get? I have female anatomy and common diseases.
And then there's pregnancy and.
Oh yeah, then we get the whole pregnancy.
Yeah.
But still, I was like, huh, I was expecting more. I'm gonna refer to this for a second. So I talked about the ovaries and the fallopian tubes and the fimbriae. This is the uterine body. And then the top is called the fundus. So if you've been pregnant and you go in and they measure your belly every visit, they're measuring what they call the fundal height. So they're feeling for the top of your uterus or the fundus, and then they're measuring from the pubic bone to the top of the fundus. Okay. And then this little bit in here is your endometrium. Endo means what? Do you remember that from cardio? Inner. Endo. Yep, within. So it's our endometrium. Okay. And then this is our myometrium, and myo means what?
Muscle.
Muscle. Yep. So we've got our endometrium and our myometrium. Sounds very familiar, right? Because we have endothelial tissue in our heart, and we've got myocardium. Okay. And then what is, depends on which you're reading. I think the book just calls it vagina, but there are some books that will call it the vaginal vault.
That sounds like it's from a movie.
It does, doesn't it?
Like Enter the Vaginal Vault.
Right. I don't know why.
Or lightsabers.
Yes, so the vaginal vault. It's like, but hey, you know, I've watched the prison movies. They use the vault to store important things when they're smuggling them in, right? Okay. Maybe that's who's writing the textbooks, or the doctors in prison. And then your cervix. Whew. It's almost break time. That's good. And then our cervix. Okay. If somebody has a hysterectomy, there are different types of hysterectomies you can have. You can have a total hysterectomy, which would be all ovaries, fallopian tubes, and the uterus, or you can have a partial hysterectomy, where they leave an ovary and then take the uterus and the fallopian tubes.
When my mom had her hysterectomy, they just removed the uterus. And then she ended up having an ovarian torsion, which turned into, like, it turned itself, it twisted itself, but she also had a cyst growing off of it that was like the size of a cat. So she was doubling over in pain and felt like she was dying. And
So that had to go too.
yeah, so then they just removed the first one, and then she had complications with the other ovary, so they were like, you're done.
So a total hysterectomy, where you take the ovaries, the fallopian tubes, and the uterus, is called an oophoro salping hysterectomy. Salpingo hysterectomy. Yep. So oophora for the ovaries, salping for the fallopian tubes, and hystero for the uterus. Or you can just have salpingo hysterectomy. So we've got multiples. We try to, when possible, leave at least one ovary during the hysterectomy, because that's where our sex hormones come from. And if we remove all of the ovaries, then we put the patient into early menopause, and they have to be on hormone replacement. So before we, well, it's kind of early. Yeah, but we're gonna do it anyway. Before we get into the disorders, let's go on break. Let's just come back 5 minutes early. So we'll come back at 10:35. And remind me to start this again. I'm gonna pause it.
Sorry, Rowan.
Yeah, well,
Just to make himself feel comfortable, and then like, they're not funny jokes that nobody laughs, so he just feels awkward.
poor guy. You know how you fix that? You go work for a urologist. You get over any hesitation you had looking at old guys' penises all day long. You just get over it.
I think it also depends on like how you're raised too, because like if you're raised in like a pretty religious family, you're kind of like,
You're like
talk
very
about that
sheltered.
stuff.
I got over it pretty quickly. I was raised, yeah. My mom just never, my parents just never talked about it. Which is something I made sure that I did with my kids. So like
That's how
when
I am.
my daughter got her period, I couldn't tell you when she got her period because we talked about it from the time she was little, so it was just something she took care of. I was like, oh look, I'm running low on tampons. Buy some more, and that was it. You know? Yeah, so it's really in how you.
See, and I've just approached it that my kids know their body parts. I approached it for a different reason, because I feel like if something were to happen to my children that I can protect them from, I want them to be able to
Just
not be ashamed
Right.
to say the body parts
mm-hmm.
that they have. And so my kids know their body parts, and they can tell me what hurts and whatever else, because it was an intentional thing, hoping that nothing ever happened,
Right.
but wanting them to be prepared if it did, that they weren't ashamed of.
Saying anything.
Yeah.
Yep.
And
Yeah.
when you say that, like,
Again, that's a generational thing that I think
when
is going.
something hurts, they'll just be like, they won't just be like, it hurts. They'll be like, my belly hurts, or
Yeah.
like,
Yeah, it's just a body part.
Yep.
Yeah. No, I think that's also progress generationally.
Yeah.
So my great grandmother died, and we knew nothing of her medical history, so we don't know. We knew that she had problems with her lady parts. Does that mean she had cervical cancer? Does that mean she had uterine cancer? What does that mean?
Right.
Right? But everything was so hush hush, and the fact that she even said problem with her lady parts was a big deal
Right.
50 years ago.
Right.
So yeah, I think again we've taken a lot of that away. I think that at times we are far too open. I mean, spend 3 minutes on Facebook. But I think we've made great strides in the right direction, at least from a medical provider standpoint. All right, so breast cancer. It is the second leading cause of cancer deaths in women. This is why you need to do your breast self-exams. This is why you need to have your mammograms. And if you have a family history of breast cancer, you can have a blood test done called the BRCA test. That's BRCA, and they will test for the blood or for the breast cancer gene. So
yeah,
yeah, BRCA1 and BRCA2. It's pretty cool. They won't just do it on everybody, but they'll do it on people who have a history. Oh yeah, so you could go get a BRCA blood test. It's not cheap, but neither is breast cancer.
but if you have like medical insurance.
Yeah. So we actually don't know what causes breast cancer, just like we don't know what causes prostate cancer. About the only thing that we know a cause of cancer-wise is lung cancer. And we know that smoking is one of the causes, but is it the only cause?
No.
No. So we don't actually know what causes any cancer 100%. We know that there are some things that cause, that are a cause, but there's not just one cause, if that makes sense. So with breast cancer, you really need to do your breast self-exams. A lot of women have what are called fibrous breasts, where they just have these fibrous masses that are benign. And if you have fibrocystic breasts, you should really cut down on the caffeine, because we do know that fibrocystic breasts tend to become more fibrocystic with caffeine intake. So one of the first things they do is tell you to cut out the caffeine, and I laugh and say, okay, I'm just gonna have lumpy boobs because I'm not getting rid of my caffeine, you know? And the mammogram, not super comfortable, but not as horrible as you would think. other than having somebody else manhandle you.
How does mammogram work?
Right, so they've got this acrylic plate, and it is cold, yes. And you have to put your breast on it, but the mammogram tech, you have to make sure that you get all of the breast tissue. So you kind of feel like a cow being milked.
What if you're completely flat chested?
They can still do it.
Okay.
They'll find a way.
And it's way more uncomfortable, I think, for completely flat chested. But they will, I don't know how to do this without going too in depth. They will literally massage and knead your breast tissue up, grab it, pull it out, and then put the top acrylic plate down on it.
Your balls are squished.
Yeah, you make a pancake.
It's like a pancake.
Yeah.
But have you noticed that when you're laying on your side or something like
Right. It's not comfortable, but it's not painful. And then they can rotate the plates. They can either be flat or they can be at an angle, and they can adjust them so you're not always standing on your tippy toes. You know, I've had some mammogram where I was too short, and so I spent the whole time holding onto the arm with one hand and standing on my tippy toes with the other. Yeah, like you're in a clamp. But it's just uncomfortable. It's not painful. It's really, after the first time I had one, I was like, oh my God. And then I was like, oh, I've had pap smears that are worse. The weirdest thing is having somebody grab your chest and pull all your breast tissue. For me, that's not always, that might not be the weirdest thing for other people, but that was the weirdest thing for me. I was like, are you digging to my spine? What are you doing? But it's not bad. And technology has gotten so much better that now they can do a 3D mammogram. So their results are much more accurate. So now if you get a 3D mammogram, you can trust that they're not missing anything because the 3D mammogram is so good. It's cold and uncomfortable, but not painful. One thing that they did not put on the males is, Rowan, your boy, you can get breast cancer too. Yeah, a lot of men don't know that. And I mean, small-chested women may be afraid of the mammogram. Can you imagine being a male and needing one? So, but men can get breast cancer, and some men do die of it because we don't think about it, right? It's not something you think about.
So should I be checking for lumps too?
It would never hurt. I mean, seriously, it couldn't hurt to check for lumps. Another thing that they didn't mention with men, I'm sorry, we're on boobs now and it reminded me, is gynecomastia. I mentioned it as a side effect of hormone treatment for prostate cancer, but when about 10, 11 years old, when boys start going into puberty, they may develop breasts, but not like huge breasts, like mosquito bumps. Yeah, some could get really big ones, but for the most part, it's like swollen mosquito bumps. And usually their dads will freak out and take them to the doctor and be like, oh my God, my son's going into puberty and he's got boobs. Well,
that's what Nate was saying about his son.
Yeah, it'll resolve. It'll go away.
Don't tell him that I told you, but my son told me.
But Nate knows it'll go away. Yeah, it's just part of that whole hormone influx business. And so a lot of time, at least in family practice, when we had dads who would bring their son in with gynecomastia, we spent most of the visit reassuring dad that it was perfectly normal and it will go away.
Would you get angry fathers? Why is this happening to him?
No, most of them were just super like confused and concerned, like, what is going on here? This didn't happen to me.
So why do guys have nipples just because we're on boobs? Because we don't breastfeed, we don't really use these things, they're just there. Right,
and so we're jumping ahead a little bit, but fetuses don't have a sex until later on, so we have all of the same parts. Your testicles started out as ovaries, they just fell out.
So don't they say like?
I mean, so really, during pregnancy is when our gender is differentiated, and they have found that they can manipulate that in mice. and rats. They can manipulate genders.
So don't they say that like the clitoris is kind of like
I've heard that
A
it's
tiny
really-
penis?
yeah.
Yeah, we all start with the exact same parts. It's just how we cook. I know it sounds funny, but
No, but it's true.
but that's why the clitoris becomes erect. Increased blood flow to it. It's the same type of tissue. So yeah, we are genderless the first 8 to 12 weeks of fertilization, and then the genders become more apparent. Which is why when you find out you're pregnant 4 days after you miss your period, they can't tell you whether it's a boy or girl. We have to wait until parts start developing for that to happen. But that's why men have nipples, because we all get the same basic parts. It's just how we grow up.
Will I ever lactate?
You could actually, if you're, and that's usually, I want to say a pituitary tumor problem. It might not be pituitary, but I think it is. So yes, men can lactate if their hormones get completely out of whack.
So can a woman if they're not? Can women get that?
Yeah, they can lactate. I have a friend who adopted a baby girl and breastfed her because she went on all the hormones to cause herself to lactate so that she could breastfeed her daughter. Mhm. Yeah.
Yeah.
It seems so weird to me. Like, how could it be healthy to take a bunch of hormones so that you can lactate so you can breastfeed your adopted daughter? But she breastfed her for like 3 years. And once you start lactating, once you start developing milk, she could wean off of the hormones because the mere act of breastfeeding kept her milk coming in. But it's a lot to.
They got milk for 2 years.
Yeah, it's a lot. But can you imagine bringing milk in and not having been pregnant? So
Yes.
they
I
were
can.
doing.
I was around too many people that were pregnant at the same time, and I was lactating
yes.
because of that. And I never had a kid, but I was around like 3 different girls that were very close in their pregnancy.
Yeah, it's bad enough when
They
your
were
period
always there.
starts, right?
I hate that when somebody's telling me about their period. I'm like, you shut up. Because this costs my time.
Yeah,
Yeah,
we don't need to be
that.
cycling together, right? Okay. So, gosh, how did we get off of breast cancer?
Because you
Let
had
us
to mention
regroup.
that boys get it too.
Yeah, I did have to mention that boys
Males,
get it
not
too,
boys.
because I think, yes, males get it too, because it's overlooked. So let's bring this back. Breast cancer. We can, the mammogram is screening for it. We can do ultrasounds, we can do biopsies to see the extent of breast cancer. It does metastasize, but in the last couple decades, we've done a good job of increasing our screening so we can catch it at an earlier rate. There's still some women who get it caught very, very late. Again, Mrs. Angemi, she's my go-to for grossness. She had 6-8 weeks ago, she had a picture of stage 4 breast cancer that was untreated, and it had broken through the neoplasms, or the new growths, had broken through the skin, and it looked like black necrotic cauliflower. It was because the patient chose not to have treatment. And I used to think, if I get breast cancer, then, I don't know, chemo's pretty rough, I might not. And then I saw that picture and thought, nope, I am treating it. There is no way I am not going to have treatment after seeing what that looks like. So we know that treatment is a mastectomy with a lymphectomy. Why do we have to take off the lymph nodes? Where it moves to. Yep, I'm just standing there because this is falling off. So yeah, we remove all of the breast tissue. We can have a partial mastectomy. We can have a complete mastectomy. We try to get out all of the cancerous tissues. And people who have a really, really strong family history of breast cancer may opt to have an elective mastectomy where they just have all the breast tissue removed, just so that if there's no breast tissue there, no cancer can grow in it. So if they've got a strong family history of it, there are women who will just have it removed.
How old do you have to be for that?
I don't know, I think that's a decision between you and your doctor.
My
Who was it? Angelina Jolie had an elective mastectomy.
my nana had breast cancer, and she had one breast removed.
Mm-hmm. And did it ever spread to the other one?
No, they
Yeah.
caught it early enough.
Good.
It wasn't that big of a
Good.
deal.
It's the recovery from a mastectomy is long and hard because it disrupts all of the chest wall muscles and tissues, and there's a lot of digging around. But if you can be cancer free, then 8 weeks of discomfort and pain is really not a lot, right? You can live the rest of your life. So cervical, uterine, and ovarian cancer. Cervical cancer, we screen for with regular pap smears. And we also have Gardasil, which is the HPV vaccine. Does Gardasil prevent all cervical cancers? No, it prevents a few of them caused by high-risk HPV, but it doesn't prevent all of them. Uterine cancer, we may not. Actually, we don't have an easy test like the pap smear for uterine cancer. So we may see some symptoms such as fibroids or heavy bleeding. And ovarian cancer, again, we don't have a really easy test for ovarian cancer. Okay, with ovarian cancer, we can't even really, because we don't have a good test for it. We usually don't find it until it's advanced, and then we start seeing signs and symptoms of it. Okay, we don't know what causes uterine or ovarian cancer. You could be predisposed to it. We honestly don't know. We do know that cervical cancer, a few types of cervical cancer can be caused by HPV. Okay. Dysmenorrhea. If you break that word down, it means bad, painful, or difficult. Meno would be menses, and rhea is flow. So bad, painful, difficult periods. We know that periods are not comfortable anyway, but there are some women who have periods that leave them completely incapacitated. They can't get out of bed, so that would be dysmenorrhea. Okay. Endometriosis is abnormal condition of the endometrium, which sounds like it should be limited to the endometrium right here, right? But it's not. Endometriosis is the abnormal condition of the endometrium they're talking about, is that this endometrial tissue has traveled elsewhere. So the endometrium is what we slough when we have our periods. So every month, as we go through our hormonal cycles, it builds and then sloughs off and builds and sloughs off. But with endometriosis, this tissue can be growing out here in the abdomen. It can be growing on the outside of the uterine wall. It can be growing throughout the abdomen. And so you might have days where you're fine, where your hormone levels are even. And then as you start cycling up towards your period, you start having more and more pain because all of the endometrial tissue is responding to that change in hormone, not just the stuff inside your uterus. Does that make sense?
Why do I feel like I'm gonna get my period?
I know. I hope I'm not talking y'all into it. But so yeah, this endometrial tissue can be spread throughout the abdomen. And for a long time, endometriosis was misdiagnosed or not believed because it presents as intermittent abdominal pain. And remember, I said that abdominal pain, I don't know, I said this a couple days ago, that abdominal pain is kind of a mystery. We don't know. There's not many structures in the abdomen that can cause pain. So women who have endometriosis have intermittent, debilitating abdominal pain, and it's because those tissues grow with the hormones and then die off a little bit. They grow with the hormones, then die off. So it can infect the entire, and infect is maybe not the right word, but it can happen at anywhere in the abdomen. Treatment for that, once they diagnose endometriosis, if it's a fairly mild case, they might just put the person on hormone replacement therapy or on birth control pills to keep the hormones level. That might work for a little bit, but typically you end up having to go in and have it scraped out, have the tissue scraped out. Fibroids are what they sound like. They're balls of fiber that build up within the uterus. Fibroids can cause really heavy periods. So we talked about dysmenorrhea being bad, painful, difficult periods. That goes hand in hand with fibroids. So women who have fibroids bleed very, very heavily during their period. And I mean, like bleeding to death heavily. And they pass clots that are enormous. I've heard reports of softball-sized clots. Passing some clots is normal during your period, but clots, huge clots that you can feel exiting your body, that's not normal, okay? A lot of women who have fibroids can either go in and have a hysterectomy, which is kind of a last resort. We can go in and have a D&C, which is a dilation and curettage, where they go in and they just scrape the inside of the uterus, get rid of all the fibroids that way. They can do a steam ablation, which is kind of cool, where they give you some Versed so you don't remember it, thank goodness. But they basically cook the inside of the uterus with superheated steam and cauterize it. That's all they're doing, is they're cauterizing it so that those fibroids, so that you don't bleed to death, that you don't build those fibroids. That's crazy. They will often start with hormonal stuff like Depo-Provera or Nexplanon. They might start with that because it gets, we're talking pretty serious stuff if we're scarring the inside of the uterus. So with young people who have fibroids, they're going to try to go the hormonal route first before they go to the D&C, which is fine. The D&C usually doesn't leave scar tissue, but definitely the steam ablation leaves scar tissue. And then if you have a hysterectomy, you'll never have kids, right? Because your baby cooker is gone. Fibrocystic breast disease, we've talked about. It's lumpy, bumpy breasts. And it is very much tied to caffeine, but not always. The first thing they tell you is to cut down caffeine, but it tends to run in families. Women who have fibrous breasts or fibrocystic breasts and tend to run in families. And you would notice this during your self-breast exam. If any of your normal lumpy bumpies change or become tender or move or grow, that's when you really need to go in and see the doc to make sure that it's not cancerous. Cervicitis, what's that?
Inflammation of the cervix.
Exactly, inflammation of the cervix. Typically, it's a bacterial infection, and we typically have cervicitis is usually caused by some sort of STD, not always, but one of the signs and symptoms of an STD is cervicitis. Does that make sense? It's not always caused by it, but one of the signs is this. And since it's caused by a bacterium, how do we treat it?
Antibiotics.
Antibiotics. Pretty simple, right? PMS, I think all women suffer from it a little bit because your hormones are, but when they're talking about PMS here, they're talking about severe PMS, the homicidal, crying, severe.
So I want to kill my man if he doesn't buy me stuff.
Yeah, the severe one. That is debilitating. I mean, we all suffer from it a little bit, but then there are debilitating one. And there's, our textbook's not cut up. There's a severe form of PMS. It's PMDD, premenstrual dysmorphic disorder, I think is what it's called, where it's really takes it to the extreme. And we can treat that with like birth control, forms of birth control. If we stop your period, like with Depo-Provera, our hormone levels are here, right? So that takes care of things like dysmenorrhea and PMS and PMDD. It takes care of all of that, if it works. Now, with Depo-Provera, you're shot in your butt. It's great birth control if it works. And it does work. But what I mean when I say if it works is some women bleed for 13 weeks on Depo-Provera, and some women lose their periods. Most women lose their periods, and it's awesome, and everybody's happy. But the women who spot for 13 weeks are not happy. Okay. So Depo, Nexplanon, the IUD, I think we'll talk about those later. Those all release some form of hormone that just level everything out. And that if we level these out, then we can avoid a lot of the problems. Vulvovaginitis, I always sound like I'm saying like the car, Volvo, but it's not. It's our vulva and our vagina. Inflamed, what? Vulva and vagina. We can figure this out. Again, can be caused by bacteria or an STD. Whew. Are we ready for pregnancy?
No. I don't want to be pregnant yet.
Good for you.
Oh, thanks. You just wasted. Are we ready for pregnancy?
No. Good for you. Good for you. So, fertilization, where does it occur? In the woman's body? In the fallopian tubes, yep. And then it needs to move down and implant into the uterus. In the prenatal period, which means before birth, pre means before, natal means birth. Okay, we have the blastocyst, which is the immediately impregnated egg, and it starts dividing, becomes an embryo. We have the placenta, which is filled with the amniotic fluid, and that amniotic fluid provides protection and cushion for the embryo, fetus, baby, however you want to call it. Because we start with a blastocyst, and then everything divides so quickly, all of the cells divide so quickly that before you know it, there's an actual baby in there. The embryonic period is when the primary germ layers develop, and the primary germ layers are how we're going to, I don't know how to phrase it. Let's see. Whoops, sorry. The primary, or the germ layers will grow up. We started as a ball of cells, and the primary germ layers start to differentiate and decide what they're going to be when they grow up. Does that make sense? So we had a bunch of cells that didn't know what they were going to be. And then when we start developing the germ layers, now we know it starts differentiating into different tissues. Okay. After these develop, then we end up with a fetus, and super, super cute, of course.
Look at the aliens.
Yes. I think they look like baby gerbils.
You just see those little aliens because they've got like heads like going on and they're like nothing.
And little stumpy fingers and toes.
Just
And
like
the tail.
aliens. Yeah, they look like little. Yeah.
They're super cute.
The nurse after I had my daughter, because she did this like weird thing where she would like,
Mhm.
she's newborn baby, just like would stick her tongue out. I said that she looked like a lizard but acted like a snake, and sounded like a baby goat. And the nurse told me I wasn't funny. And I was like, I'm so high on drugs right now, I don't even care.
It's totally funny, right? Right. So with fetal circulation, baby will eventually develop their own blood supply. We live off of mom's blood supply through the placenta. Okay, so we've got the umbilical cord that carries blood to the baby and waste and stuff away from the baby. But the baby has to develop their own heart and circulatory system, right? Fetal blood, if mom is RH negative. So you know the blood types, A, B, O, A, B, okay? And then we've got positive and negative. If mom is RH negative, we have to hide the baby from her bloodstream, from her immune system, actually. So we give a shot called RhoGAM at 28 weeks of pregnancy, and then we give it again immediately after birth in case any of the blood has mixed. And the reason we do this is statistically, even if mom is negative, RH negative, statistically, the baby would be positive. It's not always the case, but it's never going to hurt to hide the baby from mom's immune system. If we don't hide the baby and there's some mixing of the blood, mom's RH negative blood sees the RH positive blood
And has a panic attack.
yes, sees it as a foreign invader,
Yeah.
builds antibodies to it. So in the first pregnancy, it's usually no big deal. But the way our immune system works is we build the antibodies the first time we're exposed to something. And then the second time we're exposed to it, your body goes kill, 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 and attacks it before you ever get sick. So if mom's RH negative blood meets baby's RH positive blood, first pregnancy, probably not a problem. Second pregnancy, though, when they see each other, mom's blood is going to say, oh, I thought I killed you last time, and attack the baby. So that's why we hide the baby by using RhoGAM. And we'll get way more into that in hematology class. We don't use, fetuses don't breathe air, right? Do they have to do some form of breathing in the uterus? Yeah.
They practice, they like breathe in like
The amniotic fluid.
Yeah.
Yep. They have to, that stuff's got to get worked out before they come out into the cold, hard world. Okay. So the circulatory system of a fetus is slightly different than that of a newborn baby because they get all their blood nutrients from the umbilical cord. Okay.
Have you seen those videos where like babies are sleeping?
Yeah. It freaks me out a little bit.
I think that's weird, but
Yeah.
is it because of the
There is
they just know?
something called the mammalian dive reflex. And babies, it's very strong in babies. So their body, when they're immersed in water, all the metabolism and breathing and circulation slows way, way down. So if a baby were to ever fall into, I don't know, the Poudre River, and I mean a baby, if they were to fall into the Poudre River, they have a better chance of survival than an adult because that mammalian dive reflex shuts everything down. So we were told, gosh, when I was in EMT school, that a body isn't dead until it's warm and dead because that mammalian dive reflex can make everything so slow that you may not be able to detect a pulse. So you have to bring them back up.
that image just terrible.
Isn't it awful? It scares me. So yeah, babies in swimming pools scare me.
They naturally know.
Yeah. I love that it came about after my kids were older, and none of my kids are very strong swimmers, and neither am I. I could save my life, but nobody else's if I was swimming. But the baby safe swimming programs, have you seen those?
That
Where they
emergency
teach them
response,
to,
like if they get out the back door and they go into the pool,
yeah, they
can
teach them
flip
to,
themselves
yes, that's
and then just
awesome.
stay there and scream.
Scares the daylights out of me every time I see those videos, but I think it's a great thing, and I think
They teach the babies, like, because about 6 months old is when like they can crawl and stuff typically. So they teach the babies to float on their back and scream, and they teach the toddlers to roll onto their stomach, swim to the edge, roll onto their back and scream, roll onto their stomach and swim, and then.
it's a great thing. I wish I'd been around when my kids were little. Maybe they wouldn't be. Because since I don't like water, I know I pass that on to my kids. You know, I'm afraid of water. I was born and raised in Colorado. What kind of water do we have?
Really stinky lakes.
Right.
When they do water births, when the baby's born, do they breathe into water?
No.
They don't realize they're born yet.
Right. That's the whole point of the water.
But they're doing that inside the womb. They're breathing in like the amniotic.
A little bit, yeah. So there is absolutely a risk of aspiration with water birth. There is. I Yeah, I should talk to my neighbor. She's a doula. I think that water births are just delaying the inevitable. The baby still has to come out of the water into the cold world, right? But
Is it more comfortable for the mom or something?
it's supposed to be more comfortable for mom and baby. It would not be more comfortable for me because I am not sitting in a pool of blood and amniotic fluid. But it's one of the births my neighbor does. She is, as a doula, she coaches births like that, and she loves water birth. I can't wrap my head around it, but so there is a risk of aspiration, yes. But there's a risk of aspirating your amniotic fluid as well. It's crazy. I should actually have a conversation with her about how it's better, because you're just delaying the fact that you still have to take them out of the nice warm water. It's way good for mom. That hot water is really good for relaxing the muscles, and it makes the birth easier on the mom, definitely. Okay. So the heart has an opening between the upper chambers called the foramen ovale that will close before birth, because the heart is pumping in a baby because it has to get up to speed. But it's not like they're breathing oxygenated gases, and so their circulation is different. That should close up, that foramen ovale should close up before birth. Ductus arteriosus is an opening between the heart and the aorta. So that should also close up before birth. If not, they can go in and surgically close this.
One of those things didn't close up on my baby.
Did they I almost asked if they surgicated it. Did they surgicate it?
No, they just said hopefully it'll close on its own. We're not going to worry about it too much.
Right, and then they go back and check in a few
they're
months.
constantly checking, and she has like a heart murmur and stuff. So
I would say it's probably the foramen ovale.
Yeah.
Okay, this one, because it goes to the aorta, they will go in and they will surgically close that.
It was just one of those, I was like, well, why didn't, they're like, usually with that sharpness of that first breath, if it didn't close prior, with that sharpness of the first breath, it snaps it, but it didn't happen. Or like squeezing through she was a C-section baby, so squeezing through the birth canal didn't happen for her.
Right.
So.
Right. So hormonal changes during pregnancy, the reason we can find out from a urine test if we're pregnant or not is because of a hormone called HCG, and that's human chorionic gonadotropin. And some of you may have heard my whining about Godzilla. In the movie Godzilla with Matthew Broderick, he realized that Godzilla was a female and was pregnant, so he went to the drugstore and got a bunch of pregnancy tests so he could test her urine. The major problem with that is it's human chorionic gonadotropin, not Godzilla chorionic gonadotropin. That completely took me, and they tried to explain it, but it's human chorionic gonadotropin.
How do they not?
They explained it in the movie, but it didn't work. It didn't work for me. It completely took me out of it. Yeah, yeah. It just didn't work.
You can't like pregnancy test the dog.
Not so well. I've heard people who've tried it and had success, but I don't think that's an actual thing.
So how do you false positives?
False positives and negatives happen just because everybody's hormone levels are a little bit different. So if you test too early, the levels haven't come up in your body yet, and so they're just not the urine test just isn't detecting it. We can have false positives if somebody's pituitary gland is maybe not working so well, or they had a miscarriage, so the levels are still high. And some women have miscarriages without knowing it. They're like, oh, my period's late, and then they get their period and they're like, oh my God, that was an awful period. I hope that never happens again. And their HCG levels may be high. Urine HCG levels are not the greatest. They're a good way for a woman to say, maybe I should make a doctor's appointment. And the first thing we're going to do is we're going to draw serum. We're going to do a blood test because we'll have better readings of that. And your HCG should double every day for a certain period of days. Okay. After a miscarriage, it comes back down, but it's very slow to come back down. So if you were to take a urine pregnancy test, it may still show positive. Yes?
So like when I went to look at my next one on, the lady was all telling me that like I'm having babies or whatever. But like it is that you could like get pregnant and then just would you just call it like a miscarriage like you just said, like and you just have a period but it's really heavy or what? Because that's what she's like, well the whole idea of birth control is that it prevents you from having a baby, but yet again there is a chance you get pregnant but it just doesn't.
It may not stick. It may not implant.
Right. So
It could be. I know people who have gotten pregnant on, I have 3 birth control babies. And yes, I took my birth control at the same time every day religiously. And no, I was not on antibiotics, but I've had 3 birth control failures. And I love them. But
like she's like, well, that's why sometimes like if you are having, well, I guess you just call it miscarriage or whatever. That's why there's like a lot of blood clots.
yes. So it could be just delaying your period. It's the hormones are so wacky that it could just be delaying your period, so you're having a heavier period, or it could be that you had incidentally gotten pregnant and not been able to implant, and then you have a miscarriage based on the hormones from the next one on. Yeah. Really, what we're doing is we're just leveling out the hormones and we're tricking your body into not having periods with things like Nexplanon and Depo-Provera and IUD. We're just messing with your hormones. Okay, so it doesn't talk about this in here. Term is, so we know we have 3 trimesters during a pregnancy, right? A baby is considered full term anywhere between 36 weeks and 42 weeks. If you go to 40 weeks, your doc's going to start getting a little itchy. At about 41 weeks, your doc is going to talk about induction. And at 42 weeks, that baby's got to come out. Okay, so they start getting a little nervous about that time. Just number one, the baby grows so much in the last trimester. And, you know, your placenta and your amniotic sac, they're only meant to last for so long. So things start degrading, and the risk of birth defects, not birth defects, but the risk of problems with the baby increase the longer the baby is still in utero. So that's why docs start getting nervous about 41 weeks, and at about 42, they're like, baby's got to come out. We're scheduling you for a C-section or an induction. Yeah, just because we want to avoid any issues with baby. The amniotic fluid is no longer viable, and it may be that baby has gotten too big as a ratio to the amniotic fluid. It's just baby's got to come out about 42 weeks. The birth process, those of you who have not been through it, is every bit as painful as it sounds. So the cervix has to dilate, and it dilates to 10 centimeters, which is about 4.5 inches. And everybody, first time pregnancy, everybody's worried about the head. The head is the easy part. It's the shoulders. Yeah, show everybody else. Yeah, so that's how much your cervix dilates to an opening about like that. That's crazy, isn't it?
Yeah, that's pretty big.
Yep. Yeah, the head, that's easy to birth. The shoulders, not so much.
Like hooks.
Yeah.
My mom's a teeny tiny little person, and she had 2 very broad-shouldered children. They had to go in and fold us
Yeah,
to help
to
us
get
get
you out. Oh, yes. So dilation is when the cervix opens, and I don't think this is an exaggeration. That should be about 4 inches. And then it faces, so it thins out. So just think about anything else. When you stretch, if you take a rubber band, when you stretch it, not only does it get bigger, but it gets thinner. So when you're hearing the doc talk about dilation and effacement, that's what they're talking about. Okay. Then expulsion is really what it sounds like. The baby is expelled from the body. And then after the baby, you can't just get up and run around. You have to get rid of the placenta. So after you've birthed the baby, you have to then birth the placenta. The placenta will be packaged up and sent to pathology, where they will examine it to make sure that the entire placenta was expelled and nothing is left in the uterus, because it can cause infection if it is.
What is this thing that keep the placenta
Crazy.
or eat it?
Crazy is what that thing is.
That's a thing.
It's a thing. So
It's a big thing in the
or they'll add
UK.
it to like milkshakes.
Milkshakes. Yeah.
Stop.
There is absolutely no nutritional value to that. Scientific, or if you look at the actual science, there's no nutritional value to it.
What is
It's big in the UK. And you know what else is weird in the, I shouldn't say weird. Big in the UK is to keep the, what's it called? Worse. They do not cut the umbilical cord. They keep the placenta and the baby hooked together until it naturally shrivels up and falls off.
Yeah, that's gross to me.
Oh, and yeah, there's some, you think Boulder hippies are crazy? You should talk to UK hippies. They got nothing on Boulder hippies. This whole idea of keeping your shriveled up placenta attached to your baby until the umbilical cord falls off just doesn't. It's
just gross.
How do you keep? Yeah.
How do you keep it clean? Like, is your baby gonna end up with an infection?
That's my fear. Is you've got all this necrotic tissue over here.
Where do you keep it? Like where?
You just put it in the diaper with them.
Their clothes.
Yeah.
I wouldn't be able to do that.
There's a name for it, and I don't remember what the name is. All I know is I read it and went, no way. And then I did some research, and I was like, you all are
What
crazy.
is the reasoning behind eating your placenta?
That it will replace certain nutrients in your
That's like
body.
people drinking their pee. It's pee for a
They
reason.
probably got it.
It's a waste for a reason.
Dogs eat the casing and stuff off their babies.
So
they
many people
probably
say
got it
that,
off of
yeah.
that.
So many people will say, well, if
That's
it's
so
good
gross.
enough for well, they're animals.
They don't have.
They're animals.
Oh, it's gross.
Yeah. Oh. Anyway, okay. Things you didn't know that you wanted to know, huh?
Like you just not doing something.
I know. Now, I can get on board with maybe a delayed cutting of the umbilical cord until after the placenta is delivered. Until it's done pulsating. I could get on board with that because it only pulsates for about 2 to 3 minutes after birth. That I can totally get on board with. But no. Okay. Yeah. So the APGAR test stands for something, and I couldn't tell you what it stands for, but it really is looking at baby's ability to live in the world. Okay, so the APGAR test is done 1 minute after delivery and then 5 minutes. We're looking at their respiratory effort, how well they're breathing on their own, their heart rate, their skin color, and their muscle tone. Okay, so we want to see, of course, an improvement in APGAR scores. Okay, if a baby is born with an APGAR score of 3, then we want to see them up to a 5 at the 5 minute mark. Okay, and they really should gain muscle tone pretty quickly. They're floppy when they're born because, well, can you imagine the ordeal they have to go through to get born? So they've got not much muscle tone, but as they're out and breathing on their own and moving on their own, their muscle tone increases very quickly.
APGAR stands for appearance, pulse, grimace, activity, and respiration. Grimace.
What does that mean?
It's like
I don't know, facial expression maybe? Like when they cry, like
Right.
they poke their foot, they're like, oh.
Yeah. Thank you for, I know what APGAR score is, I just couldn't tell you. Yeah.
You know how to explain it. It's just I just looked it up because if you didn't know, I wanted to know.
Yeah. So good for you, because I don't know.
You mentioned that like they do this thing where they like bend babies. What?
Oh, yeah, the PKU. Uh-huh.
Yeah. Why did they do that? Like, what is that?
Okay, so that is, we do that test about a week after birth, and it's to test for a specific disease called phenylketonuria, which we don't have much here in the United States. But in order to do that, you want to look up phenylketonuria, so I can make sure I'm giving, just look up PKU.
Okay.
It's so rare. I've never seen a case of it,
You wanna know
but
what
we
it stands
test
for?
for it. What a positive PKU test indicates. But when I said they fold their feet back, they literally take their foot and fold it back so that the top of their foot is resting on their shin bone.
That's ridiculous.
Right? It's the hardest test ever to watch. But the reason they can do that is that babies are not born with wrist bones or ankle bones. Those develop much later in life for them. So
no tarsals and carpals.
nope, no, none at all. They start developing later, like 3, 4, 5 years old.
So it doesn't really say what a positive
Yeah, it doesn't,
PKU test indicates, but it's testing for
phenylketonuria, phenylalanine.
There you go. It's
Uh-huh.
an amino acid, and that's what it's testing for, so that it's needed for normal growth and development. So it's probably testing to make sure
They have everything they
they
need.
have what they need.
So remember, amino acids are the building blocks for the molecules for the cells for our walls. That was day one stuff. We do PKU tests routinely. I have never had a patient who had a bad PKU. I think it's because our prenatal care is so good. I mean, really, we complain about healthcare in the U.S., but our prenatal care is cool.
My doctor with my second kid made me mad. He wouldn't listen to anything I said.
I'm sorry.
He was an old guy that just like, I don't
Set
even want
in
to be
his ways.
doing this. I just don't even like people anymore.
But I'm
And I
paying for my
hated him
kids'
so much.
college, that kind of.
My water was leaking. I went in to see him the night after I went to the emergency room. He was like, oh no, everything's fine. I was like, okay. I was a week before my due date, went in for I started to become in a lot of pain 2 days after I was due. And like felt like I was dying. And I went in and they were like, oh, the baby has no fluid, so we have to either
That baby's
do an
gotta come out.
emergency C-section or we can do an induction. But chances are if we do this, both of you will die. I was like, oh.
Yeah, no, baby's gotta come out when there's no
Yeah.
amniotic fluid.
So I just sat there and cried for forever.
I think that's an acceptable response.
I hated that guy. I was like, I'm never gonna go see him again. And I told everybody, don't see him. Don't.
Yeah. So before we go on break, the postnatal period is 6 weeks after birth.
Horrible.
Yeah. You've just expelled a human being from your body. And I don't know, my first time, I don't know what I expected, that would be it. I didn't expect all of the extra stuff that comes with birth. Besides the emotional hormonal crap, you are leaking fluids all the time, and you don't know whether to laugh or cry, and
Just
you're just
cry.
So you
uncomfortable.
wanted a baby this whole time you were talking about it until it got to me.
And now you remember?
Now I'm just like, never mind.
Yeah.
Not yet.
Yeah, the 6 weeks after birth can be kind of crazy. And then women, we always put so much pressure on ourselves. If you don't immediately love your baby after you give birth, that's okay. There's that whole 6 weeks of time where you've just gone through this huge traumatic thing. And so women are like, I hate my baby. And then they feel guilty for it. It's okay. Because just so much stuff has gone on and your hormones are all out of whack. It will calm down for the most part. If it doesn't calm down, then we're looking at probably some postpartum depression. And guess what? We can treat that. Okay. But yeah, we put so much pressure on ourselves that right after birth, we should be perfect and up and around and in love. And reality is birth is messy and nasty, and you just may not be right for a few weeks because you have to heal. That's why they do the 6 week follow-up. Our milk comes in, we tend to start secreting milk before birth, and that's colostrum. It's full of great stuff for the baby. Our prolactin kicks in after we give birth, and so we have increased colostrum, which is full of nutrients and antibodies and amazing stuff for the baby. And then your body will settle into milk. If mom chooses not to breastfeed, then eventually the milk will dry up. It's not comfortable. I didn't breastfeed any of my kids because I had to go back to work right away. And I mean right away, like within 4 days. There was no, I was working an hourly job. There is no maternity leave on hourly jobs. There's just not. So the breast milk will dry up if it's not pumped. It's miserable. But if you breastfeed or pump, then your milk will continue to produce.
Since you didn't breastfeed, like, are you working on with other babies?
No, thank God.
I was gonna say, 'cause
My milk would have never dried up.
Yeah.
I'd have been like a dang cow just leaking all over the place. No, I was working, I was waiting tables, and I was working in the ER and working at a high school. So I was around a bunch of high school kids.
I didn't breastfeed either, but I had my milk forever.
Right. So if you choose to not breastfeed, then to make your milk dry up, oh God, it feels like cement in your boobs. So compression bandages and ice packs and Tylenol.
This is going to be a really heavy question, but this is just for clarification and curiosity's sake. But is it true that when women are pregnant, they have an orgasm when they lactate?
Some women, yes. Some women, no.
Okay.
Yeah. And some women, when they get pregnant, their hormones go crazy and they want to have sex all the time. And some women, when they get pregnant, their hormones shut down and don't you ever come near me, you did this to me.
And that same woman can have all of those different things
in a
with
day.
each different pregnancy.
Right.
And in the whole one pregnancy, it's like, oh, I really like you right now. Now go the fuck away, or I'm gonna stab you.
Yeah. I think it's dangerous to be a male around a pregnant female.
You're either a black widow or like,
Right.
well, I don't know what else to say because I mostly just wanted to kill everybody that was around me
Right.
with my
So
fist.
your answer is yes and no.
I don't want people touching me.
I do not.
Not like disgusted by people, but I just don't want you touching me.
Right. I do not understand the people who want to come touch your belly. I do not know you. Get your hands off of my belly. Like strangers in the grocery store will come. If it was a little old lady, I let it slide because,
My girl.
yeah, little old ladies, it's like they can't help themselves. But strangers coming up and wanting to touch your belly, go away. No, you're not. I don't know you. You're not touching my belly. But it's like, as soon as you get pregnant and you start showing, it's like people feel like it's okay to do that. It's not.
My least favorite thing that I had happen to me was somebody kept referring to it as our baby. When I was pregnant with my daughter, and I finally snapped at him because we were at work. It was not appropriate. I hardly knew this guy. And it's our baby. It's our baby. It's our baby. I'm like, I'm never going to see you again after this baby's born. It's not our baby.
Right.
It's my baby and my partner's baby. You have nothing to do with this at all. I was very pregnant before I met you.
There's a phrase called forced teaming, and that's what that is. That's forced teaming. It's
It made me very mad.
salesmen use it all the time to make you feel like you're in this together. Also, stalkers and abusers use forced teaming all the time.
Yeah.
But that's what that our baby is. It's absolutely forced teaming,
Ugh,
in case you didn't.
it made me mad. Very
All
mad.
right, so we're going to go on break, and when we come back, we're going to talk about contraception. Not having babies. That's what we're going to talk about. Since my mouth isn't working, I better go get a Coke.
Don't be a fool, wrap your tool.
Oh my
That's what
God.
my dad always
Except for that she has a really twisted view on what pregnancy is, because I'm a heavy set person and she's lived through 2 of my pregnancies. Obviously, she's lived through 3 of them because she was
Right,
pregnant.
but she wasn't there. She wasn't there to observe.
Yeah.
one of them.
So she tells me, she's like, when I grow up, I'm going to get fat so I can be a mom. And I was like, no.
Sure. Okay, we've got just a couple more slides. Contraception, and yes, Larissa, you were right. They don't even.
It made me very
They
upset.
do mention mechanical barriers. So there's your condom right there.
And the chemical would also probably be like the
The spermicide. Yeah.
It was just one of those, like,
Right.
one of the problems that I've had in my relationship is that, like, my kids and dad, after I had our 3rd child, was you should just get your tubes tied before I had her, because we knew that we were going to do a C-section, because I just didn't want to risk anything. thing.
VBACs are difficult.
Yeah, and so I knew that I was going to do a secondary C-section, and he was like, you should just have them tie your tubes
While you're in it.
while you're in there. And I was like, no, because I want 4 kids. And I know that I have to like actually have money to do that. And he's like, you should just do that. And I'm like, you know what, if you're the one that's done having kids, because we have relationship problems, and if he's done having kids, fine, but I want to know if I go into another relationship, if this doesn't work, that I can have my 4th child if that's what I want to do, if that's what me and my partner decide. And I was like, so why don't you just go get a vasectomy? And he was like, I don't want to do that. It's too much. I'm like, stop being a crybaby. I'm like, if you're that worried about it, go get a vasectomy. If you don't want any more kids, you make that choice.
Right.
And he's like, it's your responsibility, and I shouldn't have to worry about this. And I'm like, it's not my responsibility. I know that I can handle another child. I know that I'm capable of taking care of children. If you don't want another one, you go fix that problem. I'm not doing that to myself.
Right. Yeah.
And I know a lot of women that have had tubal ligations and that end up, like my age or a little bit younger, that end up having a lot of reproductive health problems later on in life, and they can't say it's because you had the tubal, but that's the only common denominator in the things that they've had. And my mom begged me, she's like, please just don't do it.
Right.
So I'm like, okay, I won't.
Right. So, on to contraception. Coitus interruptus. It's really the fancy way of saying the pull-out method. Do you know what we call people who use this?
Stupid.
Parents.
Hey, it's the same
Parents,
thing, right?
And the rhythm method. You guys know what the rhythm method is?
Yeah, it's like tracking your cycle and then
Right. Yeah, you track your cycle for your safe days. And guess what they call these people?
parents.
Parents, yes. These don't work very well. Although, for many, many years,
That was recommended.
well, that's all they had. We didn't have condoms. So this is the only way you could do any sort of family planning was coitus interruptus or the rhythm method. Neither one worked very well. We all know people who a few generations ago had 8, 9, 10 kids.
But can
Right.
the rhythm method be helpful if you're trying to get pregnant?
Yes.
Yeah.
Yeah, so you're doing it for a different reason. You're tracking temperatures and hormones and stuff. Yeah.
Well, and I know that pre-ejaculation doesn't have any sperm in it,
Mm-hmm.
but I mean, I know those little guys like to hang out. And
Those little
like,
guys
wait
just
around
love to
all
hang
day.
out, yeah. And I mean, while millions are ejaculated, and it only takes one to get pregnant, right? So, and that's why when a male has a vasectomy, that's why we make them bring semen samples back till we don't even see one. A dead one, an alive one, it doesn't matter. We want to see no swimmers because it only takes one. Okay. Mechanical and chemical barriers. This is the one nod to men having responsibility in family planning, and this would be condoms and then spermicides. Have you guys ever watched any of the old episodes of Seinfeld? Anybody know who Seinfeld is? Okay, well, they had a whole episode on the sponge, which was a spermicide-filled sponge that the woman would insert into her vagina, and that's what she would use for contraception. It worked great. In fact, they actually quit manufacturing it. Where was I working? I think I was working in the doctor's office or in the ER when they quit manufacturing it. I don't know if it's true or not or a rumor, but I heard that they quit manufacturing it because they couldn't keep up with demand because it was such an easy thing to use.
Could you make it
I
yourself?
don't know. No, you can't. So it wasn't an actual sponge. It was made of stuff that would degrade.
Yeah.
It was full of stuff. Oral contraceptives. These are birth control pills. We've had these around since, well, they really got popular in the 60s. They were one of the better forms of contraception for women. There are some drawbacks to the pill, and that is that if you are a smoker, you are at higher risk for blood clots. We talked about the danger of blood clots. You also, if you have a family history of breast cancer, you have to be very careful with any of the hormone therapies, and birth control pills are a form of hormone therapy. We can use them for contraception, and we can also use them for things like dysmenorrhea. Something to note about birth control pills. They must be taken at the same time every day. And if you are on antibiotics, you need to use an alternative form of birth control until your next cycle. Because there's just something about the antibiotics that interacts with the birth control, and next thing you know, you got a baby. Okay.
Just children.
I want to say yes, however, there's always an exception, right? So anytime a woman is on any type of hormonal birth control and on antibiotics, then you should use alternative contraception for a few weeks. We have injectable contraception, which would be the Depo-Provera. I loved it. I thought it was God's gift. Love Depo. However, you can only be on Depo for about 10 years. What they found was that it causes osteoporosis. So while Depo is amazing for some women and horrible for others, it can cause weight gain, a lot of weight gain. I didn't have a problem with that with Depo. It can cause your periods to end, or it can cause just spotting for the whole 13 weeks that you've got your Depo. So people either respond really, really well to it or not at all to it. Okay. We've got insertable contraceptives, which could be the Nuva ring. Do you guys know what the Nuva ring is? It is a ring, a little ring like this, that you insert, and it sits up against the cervix, and it's just a ring, and it emits hormone. It's good for 3 weeks. After 3 weeks, you take it out. You have your period, you put a new one in. That is actually really great for teenage girls because they're really bad at taking oral birth control pills. Really bad at it. The problem is that not only should they be using that, but they should also be using a condom. We should always, if you're not in a committed relationship, should you always be using a condom? Yeah. There's some really scary, icky, drippy diseases out there that we don't want. So, yes. I know it's very gross, but that's.
Moist and crusty.
There you go. I was going to say crispy, but just
Okay, so we should always, if you're not in a committed relationship, you should always be using a condom anyway. But the insertable contraceptives would also include a diaphragm or cervical cap. A diaphragm or cervical cap you put in, and it sits up against the cervix right here, and then you would put spermicide on it, insert it, and then you would take it out later. Implants, something like the next one on. Those work fairly well for some women and not well for others. And there's not one good birth control that is good for everybody, right? It's not the same. Transdermal, this would be the patch.
So I got my next one on like a month or two ago.
Uh-huh.
And I had a bruise. You know?
Right, we looked at it.
Yeah. But now it's just dark around it. Yeah. It's just darkening. It's starting to see.
It can be, yeah. Hormones can cause skin darkening, and it's probably just some leftover bruising.
Like around it.
Yeah. Yeah, it's probably still some leftover tissue damage bruising. It may resolve, it may not. You have to talk to your doc. The transdermal, what are those called? It's a patch. not Ortho Evra. Is it Ortho Evra? I don't remember, but it's a patch that you put on and you leave on for 3 weeks. You take it off, you have your period, you put it on. The great thing about that is that it's, you don't have to remember, just like with the Nuva ring, you don't have to remember it except every 3 weeks. The drawback is that if you have really dry skin, it tends to fall off, and that's a problem. IUDs are making a comeback. They were really popular in the 70s and 80s, and then they kind of fell out of popularity. And in the last 5 years or so, we're seeing a resurgence in IUDs, intrauterine devices. They emit some hormone, and they also physically are supposed to prevent implantation of an embryo.
But then can't they implant?
Yes, sometimes they do. I have a friend who has 2 boys. She was on the IUD, and not only did the eggs implant, but the placenta grew over her IUD. So they couldn't even take it out, she just said. So then she was worried, of course, about the effect of the hormones on the baby. And it turns out they're both fine. But yeah, that was a 1970s IUD. It can, and it can fall out. It can cause some uterine perforations if it shifts a little bit. Like I said, they were super popular in the 70s and 80s, and then they kind of fell out of favor. And now they have redesigned them, and they're a lot safer now than they used to be.
I have a friend who has that, and she says that it feels like she can feel it.
Mm-hmm.
Like when she sneezes and stuff, she says it like.
It may not be fitted correctly.
She took it out, but when she had it in or whatever, it just so she could feel it. Like when she was on her period or whatever, like when you sneeze.
Yeah. Yeah.
And then she said that when she sneezed, she could feel it.
Yeah, I don't think I would like it. I've stayed away from those. And then your cervical method would be a tubal ligation. They also, for a while, they were really pushing the fallopian tube implants. I don't remember what they were calling them, where they were putting a spring into the fallopian tube that was causing, it was an outpatient procedure. They could do it in your doctor's office. So they would put this spring, this coil in your fallopian tube that would cause scarring. So you would essentially have the same effect as a tubal ligation without the long recovery and the general anesthesia. And that was only being pushed for about a year or 2. I haven't heard anything about it recently. If I'm going to have a tubal ligation, I'm going to have a tubal ligation. Wait, I did. It was awesome. Best thing I ever did. And I'll tell you, because I had 3 birth control failures, and so I had 3 kids by the time I was 23, and I was done. So I had to fight with my doc to get it, but he did finally agree to do a tubal ligation because they really don't like to do it on anyone under 25. So I finally got one. For me, it was the best thing ever. I am still so traumatized about the thought of being pregnant that, and I love my kids, but that's a lot of responsibility raising up babies. But I had nightmares for 10 years about getting pregnant. So not only did I have my tubes tied, but I stayed on Depo for 10 years just to double up and make sure I could not get pregnant. After about 10 years, the chance of getting pregnant with the tubal ligation decreases. So for 10 years, that was my worst fear, that I was going to get pregnant. Oh, yeah.
What birth control is that?
Orthonovum.
Be careful here.
Yeah.
I'm trying to like make sure. Just kidding.
Yeah, Orthonovum, Orthotricycline, and Ortho777. Because each time they're like, well, we'll just give you a stronger one. Oh, we'll just give you a stronger one. And when I was pregnant with my son and I said, this isn't happening, I said, oh, we'll just give you a stronger birth control pill. And I was like, oh no, you're going to give me some scissors and you're going to do some cutting. And I made my doc save my fallopian tubes and show me.
Because you wanted to make sure.
I wanted to make sure that there was no way they were going to grow back. So he did. He cut out 1/8 of an inch of each fallopian tube, put it in a biopsy container, and had it waiting for me when I woke up. So I was super happy. I love my tubal ligation.
Just so the tubes don't actually get tied, like they say.
They used to. It used to be a suture tie, but they're not like taking two ends of it and tying it in a knot. They're using a suture to tie it off or clamp it. I told them clamp it, burn it, and cut it.
I was gonna say, don't they burn it like with?
They can, yeah.
Yeah.
So they'll cauterize the ends to close it up. So I made him take out a piece, clamp it. He used vascular clamps to clamp it, and then cauterized it. I said, no, I'm never getting pregnant again. Which, you know, now I'm like, why was I so traumatized by pregnancy? I think it's just because I was the breadwinner and working 3 jobs. So 3 babies was way too much. But yeah, the thought of just the potential of another baby was just not working for me. Because I thought about sex and got pregnant. My first 2 are 18 months apart. My last 2 are 15 months apart. Like, I got pregnant the first time I had sex, pretty much, after birth. So, done. So while I think it was a great decision for me, other people, it's not the right decision. Running out of time here. Okay. Infertility. A lot of women, and so I always feel bad when I complain about getting pregnant because there are a lot of women who can't get pregnant. And I feel awful for them. We each have our crosses to bear. Mine was that I was a fertile myrtle, and other people aren't so lucky. If somebody is infertile, we can do some tests. Semen analysis is one of the first ones we do on men to make sure that their swimmers are swimming properly. Okay. Monitoring body temp so that we know when the woman's most fertile time is. We look at hormone measurements. We'll do an endometrial biopsy to make sure that the endometrium can support a pregnancy. UAs, hysterosalpingogram. So if a hysterosalpingectomy or a salpingohysterectomy is a hysterectomy, a gram is what? Just recording it, so they're just going in to make sure everything's working. A laparoscopy is going into the abdomen with a little camera to make sure everything's working the way it's supposed to. When I was working in family practice, I swear the best cure for infertility was to adopt a baby. As soon as somebody adopted a child, they ended up pregnant within like 2 months. Don't know how that works, other than their stress level comes way down, because we know that stress plays a role in fertility. So if what you're doing is you're so stressed out about not being able to get pregnant, it becomes a vicious cycle. But and remember, I was in family practice, not in OBGYN. But it seemed like anytime somebody started filling out the paperwork for adoption, they magically got pregnant. Treatment of infertility, we can't treat it till we know the cause. So you have to go through all of these tests.
That's what I was gonna ask. I was gonna say, can you start treatment after any of these, or?
Yep, once we know why the couple is infertile, then we can just go to the cause and attempt to fix it. I don't know that there's much you can do about sperm motility other than changing from briefs to boxers so they're at a better temperature.
What about dehydration?
So dehydration wouldn't have a long-term infertility effect. Because we use a little bit of fluid, but it's not a long-term thing. STDs. We know AIDS is the end stage of HIV. We did a really good job of bringing down the new incidence of HIV, but then as it became a fact of life, it started climbing back up again. HIV was, when I was a kid, HIV was this monster super bug that was going to kill everybody. You couldn't breathe a gay person's air. You couldn't be near them. You couldn't share a toilet with them. It was because nobody understood that it was a bloodborne disease. So it was a big, big deal, and everybody was scared. Most of you have been born since it was identified. Okay, all of you have been born since it was identified. And it's just a fact of life. AIDS has always been around since you were born. But it was crazy when they first identified it. Chlamydia and gonorrhea tend to be concurrent. We usually, if we have one, we have the other two. So we always test for them at the same time. Okay? And these will definitely cause the icky drippies. Now, women may not notice. They may notice an increase in discharge, but all women have a little bit of discharge anyway. Men, however, will definitely notice if there's an increase in discharge because they're usually not dripping anything. So women may not realize they have chlamydia or gonorrhea in early stages, but men will notice right away, and then they'll come in. That's about the only thing that gets men to the doctor immediately. Is anything wrong in the genital area? If it ain't right, then they'll go to the doctor. Okay. Genital warts are caused by HPV, and we do know that there are some forms of HPV that cause cervical cancer. I remember a patient's mom getting so angry at us because that's when Gardasil first came out and we were giving it to the girls, and she called and she was so angry because it hadn't been approved for boys yet. And she was just livid. She was screaming at us on the phone because we couldn't give it to her son. Well, if my son can help play a role in not passing this on to women, like, I get it. I get you. I understand where you're coming from. But we can't give something without FDA approval, especially something so new. Okay. Herpes is the gift that keeps giving. Okay. These two are viruses, the genital warts and the herpes. The problem with viruses is we cannot cure them. That's why it's the gift that keeps giving. Herpes symptoms will come and go. Once you're infected with herpes, you have it for life. And symptoms may show up, and that would be painful because herpes loves to live in the nerves. So people who have cold sores will feel before a cold sore comes on, they'll know it's coming because the nerves get irritated, and cold sores are a form of herpes. But they feel the nerves getting irritated, and they know that the cold sore is coming. Same thing happens with genital herpes, is that they know an outbreak's coming on. We cannot cure it, but we can manage the symptoms with acyclovir. Yeah, avoid sexual contact during an outbreak. Use your condoms. Condoms are not 100% against herpes. Just,
It doesn't.
Who it will never hurt to use them. So that's why I say it's a gift that keeps giving. Viral stuff we cannot cure. So HIV, genital warts, herpes simplex, we can manage the symptoms, but we can't cure them. Everything else we can treat with antibiotics and cure. So gonorrhea, chlamydia, syphilis, and trich, antibiotics will clear it right up. Now, lice, for a moment I thought that said public lice. Pubic lice are also called what?
Crabs.
Crabs. Yeah, so we can treat with stuff that'll kill that. How do we avoid these? Yes, that works too. Stay back, and condoms. Using condoms all the time. And honestly, I think this is my own personal opinion is if you're not in a committed relationship, you should be tested every year. That's my own personal thought.
Oh,
Yes, all you have to do is go to the doctor and say, I want an STD check, and they go, oh, okay. Super easy. It just gives you a little peace of mind. Okay, wow, that took way longer than I thought. So I'm going to, do you guys have any questions? Nope, we're good.
Wait, what's trichomoniasis?
Oh, trick, I forgot about trick. Trick is super cool when it's not you. It's a parasite. And it infects, it's a urogenital infection. So it's transmitted sexually, but you will find it in urine. And when you look at it on the slide, look it up. If you have your computer up, look up trichomoniasis. It's super cool because it's not me. It's this little parasite that just swims through the urine, so you get to see it on the microscope slide. You turn on the light, and it's like turning on lights with cockroaches.
What does the prefix trick mean? What does
Hair.
Okay, that's what I thought.
Yeah.
Have trichotillomania where you pull out your hair.
Right. Trick means hair. Uh-huh.
That looks like it causes
Why?
some really bad problems.
So you end up with, do you have it up?
No, I don't have it up anymore. No way.
You're napping. I don't see it.
No, it's not. It's on Rowan's.
So trichomoniasis is a sexually transmitted disease that affects the urinary system, and it gives you the heebie-jeebies.
It looks like a Brussels sprout. Look at it.
Maybe that's why I don't eat
The
Brussels
little
sprouts.
animation of it. It looks like a Brussels sprout.
Yeah. There, you should be able to find a video of, you should be able to
What
find
is
a
this
video of
diagram
it
over there?
on, somebody has it, I know.
Oh,
on
look
a
at those little guys.
slide.
Go up a tiny bit.
So you get itching and burning, just like you would.
They're still they're Brussels sprouts.
Yes. So they're kind of cool when
Or
you
like
see
gold
them.
onions.
I've only seen them in a patient once, and my doc was awesome. Okay. Whew.
Now every time I eat Brussels sprouts, I'm gonna be like, trichomoniasis.
Oh, that's disgusting. Okay, so I'm going to turn off the PowerPoint, and then I'll hand these out and talk about what we need to do with those. First, I am going to end this recording.